Okay, thank you. And I will ask you to definitely make sure that we have a quorum just so that I won't miss anyone before we begin, okay?
Okay.
I do know we're working to get Commissioner Barham on. I have not yet heard regarding Commissioner Holmes. So again, for everyone who's tuning in, we are working through some technical opportunities before we begin the meeting this evening. As you are aware, we did change this to a virtual meeting due to the increasing numbers of COVID-19. And again, this meeting is a video conference, and Henry TV will be streaming live online, and also it will be shown on Spectrum Charter at channel 180 and also on Facebook Live. So we again will begin soon, and thank you all for tuning in. Let's see. Commissioner Clemens, could we check your camera just to make sure that it's working properly? And as well for Commissioner Thomas. Okay, Commissioner Thomas, could you, there you go. Thank you, ma'am. Just want to check your camera. Commissioner Clemens, we're asking the same.
I'm in chair.
Okay, thank you. Again, we have three, and soon as yeah, we actually have four with Commissioner Thomas. I know Commissioner Barham is attempting to get in, and also I haven't heard from Commissioner Holmes. So again, for those that are tuning in, we are in a virtual conference for the meeting tonight due to the rising number of COVID cases here in Henry County. This will be streaming live online on Henry TV and also with Charter Spectrum Channel 180 and Facebook Live. So again, we welcome you all for tuning in. So can IT give us an update regarding Commissioner Barham? Because I know he's working to get in. Again, can we have an update regarding allowing
Sure.
Commissioner Barham? Yes, thank
Sure.
you.
We are trying to get Commissioner Barham and Commissioner Holmes on the virtual meeting, and the school superintendent is also having some issues. So just stand by for a second, and then I'll let you know when we're ready to go live.
Okay, well, thank you.
Thank you.
All right, okay, appreciate the update, and thank you all again for tuning in this evening to tonight's Board of Commissioners meeting. Again, we welcome everyone. We will begin momentarily. As we know, we're working through the video conferencing to make sure that we have our commissioners in who are trying to get in, who are on time and schedule. We're just working through the technical opportunities. We thank you again for tuning in. This is a video conference due to the rising issues of COVID that we're experiencing here in Henry County. And so we appreciate everyone tuning in. And thank you again for being here tonight. We will give an update in a few moments. We will soon hear from the county manager to give us the go-ahead to proceed with the meeting. So meanwhile, we again just ask you to please stand by. Thank you. For those who are tuning in, we are working through our technical opportunities for our video conference tonight. This was an in-person meeting that has been changed to a video conference meeting due to the rising number of COVID cases here. in Henry County. So the meeting will be streamed live on our Henry TV. We'll be on Facebook Live and also on Spectrum Charter Channel 180. So again, we appreciate your patience and thank you as we're waiting for 2 additional commissioners to join in who are working to log in. So thank you again for your patience. Good evening, Superintendent. Okay, can we do a mic check with you as well, Superintendent Davis, just to make sure everything is working well as we're.
Testing on the mic. It's Mary Elizabeth.
All right, thank you, Superintendent Davis. We welcome you as well as all others who are on the Zoom, on the virtual call meeting tonight. So thank you again. Again, for those who are tuning in, we're working through technical difficulties for our video conference meeting tonight. As you are aware, this was changed to a video meeting due to the rising number of COVID cases here in our county. I'm hearing I got a message in the chat that someone said that they could not hear anything. So I know our IT team is working to make sure that we're working through all challenges. So thank you for placing that message in the chat. We will be expecting an update from our IT team and our county manager very soon on when to begin. So again, we thank you all for tuning in to tonight's Board of Commissioners meeting.
Chair Wood, this is Sherry again. We are still trying to get Commissioner Holmes. No, I think Commissioner Holmes is on. We're still trying to get Commissioner Barham on.
Okay, I do not see Commissioner Holmes and I do have my grid view on. So I see Commissioner Holmes now. So Commissioner Holmes, can we check your video before we begin as well? Okay. All right, very good. Can we check your mic, your sound as well, Commissioner Holmes? Okay, we've got your video. Commissioner Holmes cannot hear you. Okay. Can we hear? Yes. Okay, I didn't hear Commissioner Holmes sound check at all.
Okay, Commissioner Holmes, is your end muted? Can you try to unmute yourself?
Just doing a sound check at this point.
Try it now, Commissioner Holmes. You're unmuted on our end, but we still can't hear you. Chair Wood, he's unmuted, but it appears that he's buffering on his end and I still can't hear him.
Oh, okay.
And Chair Wood, Dr. Lily Henson has joined the video call. You may want to do a mic check with her as well.
Okay, good evening, Dr. Henson. Good to see you. Can we do a mic check with you as well?
Can you hear me okay?
We can, and thank you very much for joining us this evening. So thank you again. Okay, let me try Commissioner Holmes again. Can we do a mic check with you, Commissioner Holmes? Okay. Okay, Ms. Matthews, so are we close to getting Commissioner Barham into the?
Staff is still working to get Commissioner Barham on the video.
Okay, well, we have more than a quorum now. We'll give them just a few more minutes and then we'll go ahead and proceed since we do have a quorum. But I do want to hear definitely Commissioner Holmes' mic check. Commissioner Holmes, can we do a mic check? And Commissioner Thomas, can we do a mic check with you as well?
Good afternoon, everyone.
Oh, perfect. Thank you. I appreciate that. Thank you. Commissioner Wilson, can we do a mic check with you? Commissioner Wilson, can we do a mic check with you? We could not hear. Okay, but you're still muted, Commissioner Wilson. Can you unmute your?
How about that?
Okay, perfect. Okay, let me try Commissioner Holmes once more. Commissioner Holmes.
I'm here.
Oh, perfect. We can hear you this time. All right.
Yeah.
Well, thank you.
All right.
Okay. Well, we do have more than a quorum, so I'm going to go ahead and proceed forward and hope that Commissioner Barham will be able to join us. I know we're working through his technical challenges right now, but again, we want to thank everyone for joining tonight's Board of Commissioners meeting. And again, due to the increasing number of COVID-19 cases, this meeting was changed to a video conference. But again, it will be live streamed on the Henry TV. And also will be on Charter Spectrum Channel 180 and also on Facebook Live. All of the public hearings that are to be held tonight individuals will have the opportunity to come to conference room B as that was scheduled because of the change at late notice and also public comments. Individuals were requested to sign in before the meeting tonight. So at this time, we will go ahead and proceed with tonight's agenda. We'll begin with the invocation, but before we begin the invocation, we will pause to pay tribute to honor Ms. Shay Head Mathis. Many of you may know or remember that Ms. Mathis served as our county clerk here in Henry County, and due to her passing, we want to definitely keep her family in our thoughts and prayers, and especially her daughter, Cam. But I would like to read the recognition that the Board of Commissioners each signed in honor and memory of Ms. Shay Head Mathis. And afterwards, Mr. Ash, if you will include a prayer for Ms. Mathis' family afterwards. So in memorandum of Ms. Shay Head Mathis, in recognition and honor in her service to Henry County government and its citizens for 17 years, beginning as an administrative assistant, and through hard work rose up to become the deputy county clerk and then the county clerk, where she was charged as the official custodian of records and board actions. A lifelong resident of Henry County and graduate of Henry County High School, Shay touched so many lives, both personally and professionally. And the Henry County Board of Commissioners wishes to extend its deepest condolences to her loving family and friends and prays for them to find comfort in their memories of her, knowing the great impact she made on so many lives, so many while here. And again, this memorandum is served by each of the Board of Commissioners. And again, we do honor and pray for the family of Ms. Shay Head Mathis and thank her for her service to this county and to our community. I will now request Mr. Ash to proceed with the invocation.
Thank you, Chair Wood.
Let us pray. Eternal Father God, Lord, we thank you for another opportunity, another rise, another sermon. Lord, we thank you as we recognize and we honor the life of Shay Mathis, God. Lord, let the life I live speak for me, God, for her life spoke volumes to this great community and her service. So, Lord, we endeavor to lift up her daughter and her family that left behind. But we do know that your word says weeping shall only endure a night. So, Father, we ask you to be with us. For every member we've lost in this community, 136 lives lost from Henry County due to COVID-19. But Lord, we still have hope, God. We still give you praise. We still give you honor. Lord, we ask you to be in the midst of this meeting as we endeavor to do the service to this great community. In Christ's name we pray with all thanksgiving. Amen.
Amen. Amen. And at this time, will you now please join me with the Pledge of Allegiance, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God,
Under God.
indivisible, with liberty and justice for all. Thank you. So at this time now, we will call tonight's Board of Commissioners meeting to order. We have a couple of announcements. The following planning and zoning items, which were advertised, but have either been withdrawn or postponed, I will call each one by the public hearing number. The first planning and public hearing that has been withdrawn is AP 20-02, which is the Hill Oxford LLC, which was appealing the denial of a conditional use request for property located at 55 Country Road Circle in District 5. Again, that public hearing has been withdrawn. The next public hearing has been postponed, and that is COMP AM-20-04, which is Mandalay Properties, which was requesting an amendment to the comprehensive plan for property located at 438 Mosley Road in District 4. And then likewise, the public hearing for RZ-20-08 for Mandalay Properties, which was requesting a rezoning from residential agriculture to single-family residence for a property located on 438 Mosley Road in District 4 has been postponed. So at this time, I do know that there are some amendments requested to the agenda. The first one is to add a COVID-19 update from partners Dr. Liddy Henson from Piedmont Henry, from Mary Elizabeth Davis, our school superintendent in the Henry County Board of Education, and Xavier Crockett from the Department of Public Health. I will now ask for a motion to accept that amendment to the agenda. Yes, okay. Okay, I saw one motion, and then we'll have a discussion. I saw, can I ask for a motion again? Okay, Commissioner Barham and a second by Commissioner Wilson. Discussion, I see Ms. Matthews had her hand up. Yes, ma'am.
Yes, good evening, Chairwood. I would like to also request that item number 8 under finance, the resolution to amend the fiscal year 2019-2020 budget be removed from this agenda, and we will bring it back in 2021.
Yes, ma'am. I was going to come to that item. We were going to vote on each item separately. So we were voting on amending the agenda for COVID-19 and to move it to the beginning of the agenda. So we accepted a motion and a second for that one. And then I was going to come to the next one. So thank you very much. We'll come to that one. So we had a motion and a second to add the COVID-19 update to the very beginning of the agenda. Any other comments or discussions? All in favor, please signal by raising your hand. Okay, Commissioner Holmes, okay, it looks to be unanimous. Thank you. The next item to be modified on the agenda is to remove the finance item 8A regarding the budget amendment for the FY 2019-2020. We'll now accept a motion to remove that from the agenda. See Commissioner Barham, and then I saw Commissioner Thomas as a second. Any discussion or comments? All in favor, please signal by raising your hand. Okay, Commissioner, okay, that looks to be unanimous. Are there any other items to be added or removed from the agenda? Okay, I'm seeing none and hearing none. Okay, now we will open the floor for a motion to amend the agenda with the statements of removing the public hearings that were stated and postponing those that were stated, and then to add the COVID-19, and then to also remove the finance items. The floor is now open for a motion to approve the agenda with those modifications. I see Commissioner Barham and then Commissioner Thomas as a second. Any further discussion regarding the agenda? All in favor, please signal by raising your hand. Okay, Commissioner Holmes, I cannot, okay. Did you raise your hand, Commissioner Holmes? Yes, okay, so that is now unanimous. We will now, again, our agenda has been approved. We'll now move into the COVID-19 update. And so I would, Mr. Ash or Ms. Matthews, I'm not sure if you're going to do our introduction, should help us through the presentation of the COVID-19 update. So Mr. Ash.
Okay, thank you. Good afternoon, Chair Wood and commissioners. Thank you for the opportunity to speak with you. Just a little background. From March the 3rd was our first COVID meeting. I can tell you, and I publicly want to recognize and thank our leadership team, our management team, our deputy county manager, our county manager, who have been so supportive of our actions through this COVID situation. Just want to share a couple things with you, and we're fortunate to have three of our critical stakeholders with us tonight. Dr. Lily Henson from Piedmont Henry Medical Center, Dr. Mary Elizabeth Davis from Henry County Board of Education, and Xavier Crockett, the District 4 Director of Emergency Preparedness. Just want to share a couple things with you guys, and after I give my information, I will allow Dr. Henson and Dr. Davis, and we'll follow up with Xavier from the district, and then we'll come back for any questions you guys have. Just want to share with you, as of today, Henry County has 9,030 COVID-19 cases. That's an increase over last week of 571. We have lost 136 members of our community to COVID-19. For good news for you, and very importantly, we want to report, thanking our leadership team, our management team, we are now operating 3 additional testing sites that we rotate through Henry County. We open our first site on Monday at Hidden Valley Park from 10 to 3. On tomorrow, we'll be at North Mount Carmel Park from 10 to 3. And on Friday, we'll be at Warren Holder and Locust Grove. So we're increasing our capabilities to do testing for COVID-19. We're very excited about that. And work with our district partners at Public Health. We will also like to announce that starting next week at the Heritage Center, we will be doing testing again on Saturdays from 9 to 3. So we'll have 6 days of testing going on in Henry County. I'm fortunate to be surrounded by such great leaders of our community, Dr. Henson and Dr. Davis, who are 2 of our most critical stakeholders, being the hospital and our Board of Education, and our students being our most precious resource to our community. We have been fortunate to work with them from the beginning of March to the end. I just want to share with you those things that are critical for us. And as we got notice today that the first vaccines are in Georgia, our team with our leadership team are working to develop the strategies that we will be using for vaccinations throughout our community. At this time, I would like to open it up for, I'll go to Dr. Henson first, and then we'll go to Dr. Davis.
Can you hear me okay? Can you all hear me?
Yes, we can hear you, Dr. Davis.
We're getting you, Dr. Davis.
All right. Well, thank you for having me. And first of all, I want to say thank you very much to the county, to Cheryl and Sherry and Don and everyone for all of the support that the county has given us, as well as the partnership that we've been able to have with Dr. Davis. So very much appreciate all of the support that we've gotten from our community partners. We saw our first COVID patient in March, as Don said. We are currently in our 3rd surge. We had our first surge in the spring, and then another surge in the summer. And at that point, hit a record number of 80 COVID patients in the hospital. Today, as of this afternoon, we have 92 patients in the hospital. Over the past week and a half, we've seen our numbers just really go sky high, as we expected from the travels from Thanksgiving, which we knew would cause some of these numbers. The good news is that we've learned a lot since the spring, when we didn't have PPE and the virus was new to us in terms of how to manage the disease. We have very experienced and caring physicians and nurses and other healthcare workers who've learned a lot during this time and have learned how to effectively manage these patients. So even though we have a lot of people in the hospital with COVID, I think we're in a much better place than we were in the spring. We also have stabilized in terms of our PPE, so that is no longer a concern. That was certainly a big concern that we had in the spring. We, within Piedmont Healthcare, are part of the vaccination program, and we are planning over the next week to vaccinate, as per CDC guidelines, healthcare workers who are in the front lines. And so our hope is that that will help us achieve some form of stability in terms of our staff, so that they are available to take care of the patients who come to our hospital. We are also excited that we are looking at doing infusions of a drug that has been shown to be effective in keeping people out of the hospital. The hope is that we will be able to do that beginning in January, once we stabilize our staffing, are able to bring in staff to do the infusions. So all in all, we are holding tight. The numbers are going up, but I have a lot of confidence in our staff, in their ability to take care of the patients. And we are very, very grateful for the support that we've received from the community. Without the support, I don't think we could do what we do. It's been a long road, and we're all exhausted, quite frankly. But with the support that we've received from the community, we know what our job is, and we're going to do it. So.
Thank you, Dr. Henson. Dr. Davis?
Good evening, Madam Chair and members of the board. It's an honor to be a part of your agenda this evening, and I actually wanted to start by thanking y'all for the public service that you have provided to our community during and through these most challenging of times. I'm incredibly thankful for the constant partnership with Don Ash and Sherry Matthews and Lily Henson, and the work we have coordinated together, I think, is a model for our state and our country. But tonight I'm prepared to provide a brief report regarding the operations of the Henry County school system, and school board members are joining this meeting via the live stream option that you provide our community. So I would also like to acknowledge their leadership during this season as well. So my report will be divided into two primary sections. I want to start with a brief overview of how we prepared to responsibly reopen school campuses after being closed for 199 consecutive days. And then the second section of my discussion, I really just want to provide an overview of how we have now continued to manage school operations once the effort to open was complete. So as most of you know, we began our on-campus learning option for families on September 28th. At that time, 36% of our families opted for an on-campus learning experience, leaving the remaining students and families opting for a remote learning experience. And of course, it's a tremendous gratitude to the constituents of Henry County who supported the East Floss program so that every one of our students has a device in their hands and have been able to learn via that device if they've opted for remote learning. In order to open facilities, we began with the development of playbooks. You can find 2 playbooks on our district website that give you the guardrails that were established in order to implement all of the mitigation techniques that we learned from all of our partners as we traverse this new pandemic. And those particular playbooks provided the structure from which every local school, each of our 52 schools, adapted a local school playbook, which really began with exactly what will happen from the moment a child is at their bus stop to the moment that child is delivered or returned to their home again in the afternoon. Every school walking through every detail of that. Once all of that was constructed, we invited our partners, including those you see on our screen, our partners from the Department of Public Health, our partners from Piedmont Henry Hospital, and our pediatrician partners in the community who have been along this journey of work with us to conduct a readiness assessment by touring 3 of our schools and identifying strengths of our preparation and mitigation protocols, as well as identifying gaps. Before we ever brought students back to that campus, we were able to resolve those gaps. Of course, our school year could not have started without the amazing coordination from Don Ash for the PPE that was made available to our employees, as well as PPE we could have on hand for any individual who came on campus not prepared with a mask. So since that time, let me transition to once we started the opening process on September 28th, we concluded that on October 26th. It took a little over 1 month to get fully reopened. And during that time, we increased from 36% on campus to 41% of our students on campus. That means we have about 17,000 students on campus, making us actually responsible for more on-campus children than many districts have in total students, meaning this is still a complex operation. And as we saw the increase in on-campus, we are now at the 17% or 17,000 students on campus, and we have 5,000 employees reporting to their work site. As we transition, we have continued to maintain now 2 meal service options for our families. There is still a curbside meal pickup option for our families who are learning remotely. And now, of course, there is an on-campus meal service option. So we continue to offer both breakfast and lunch for all Henry County students. And for any student, it is free of charge this year due to a waiver through the federal government. We have now served nearly 1 million meals through that program. So we have now actually completed 17 weeks of school, and 11 of those weeks have been with an on-campus option. And what we know today is definitely more than we knew in March. And it's more than we even knew in July when we were preparing for our start to a new school year. We did not know at those times what role schools would play in the spread of COVID in a community. But what we do know today is that schools are not a catalyst for community spread of COVID-19. And although we're confident that they're not a catalyst, there is no doubt that schools cannot be insulated when community spread changes course or begins to rise, as we've seen following the Thanksgiving holiday. So as we track and analyze and report every positive case of COVID that impacts any one of our 52 campuses or facility work sites, we continued to see steady numbers of positive cases until last week, when we peaked at our high of 75 cases of COVID that impacted the Henry County Schools campuses. Now, I think it's important to put that data in perspective for the purpose of this conversation. In this last week alone, 20 of our 52 schools reported 0 positive cases. And since September 28th, our 22,000 total individuals of students and staff, only 94% have actually had an uninterrupted schooling experience. But of course, when it is interrupted with a positive case and the resulting close contacts, that creates you feel the significance of that impact. So in our board adopted plan, we have a protocol for when it may be necessary to close a grade level, a school, or a cluster of schools. And honestly, as has been the case since March, we do not have the option of operating unilaterally on any one of these decisions. So our board adopted plan outlines those steps, and it of course includes this constant coordination and consultation we have with the Department of Public Health. So in addition to monitoring the community spread, there is also a strain on staffing at each of our schools that we monitor due to quarantining. So one such instance happened last week when we took the necessary steps to transition Tussa Hall Elementary School to a completely remote alternative for the conclusion of this semester and closed that facility. It was due to a combination of an elevated number of positive cases along with the impact quarantining had on close contacts or the supervision of students who were on campus. Tussa Hall also happened to be one of our schools with a high percentage of on-campus learners. So there is no doubt that the recent community spread is concerning to me, to our Board of Education, and to our entire organization. And if these rates were to be sustained over multiple weeks, we would have to consider even more drastic measures. But what we really know is that our schools continue to be as safe as any public space in our community. And when one adheres to the protocols that we have put in place per the recommendation of our medical professionals, wearing a mask, watching one's distance, and washing one's hands really does reduce that risk substantially. So we're continuing to monitor community spread and on-campus case instances. And of course, we invite our community to visit our website where we weekly update our COVID cases that impact any campus. We are, of course, monitored by both the Georgia Department of Education and the Georgia Department of Public Health. So we have confidence in the monitoring of our data before it's even publicized for display. We really want to do that right and be reliable. So as you know, I believe together we really can keep Henry healthy, and we really want to continue promoting this mask use, not just on our campus, but outside of campus, watching distance and washing hands. And as always, is our desire to keep the community informed. I have to take a moment and thank the Board of Commissioners for your support as we celebrated School Heroes in Henry on Monday, just yesterday. It was a remarkable success as our community came together to show appreciation, love, and gratitude for those who are working in our school facilities. Mr. Ash, that concludes what I've prepared, and I'm happy to turn it back over to you.
Thank you, Dr. Davis. Lastly, we'll hear from Xavier Crockett, who's the District 4 Emergency Preparedness Director.
Hey, Don, how are you doing today? Can you hear me?
Yes, sir.
All right. Well, I appreciate you guys allowing me to present to the board today. We thank you for the opportunity. So what we have seen since Halloween is a continuation of increases in our daily positive COVID-19 numbers, hospitalizations, testing numbers, and deaths. That's across the state as well as in Henry County. Georgia has hit record high numbers in three of those categories, which is the daily positive COVID cases, the hospitalizations, and record testing numbers. To give you a summary of where we've been since October, for the month of October, we had in Henry County 1,046 cases, and for the transmission rate, it was at 436. Following Halloween, we saw a significant surge in cases in ages 1 to 24, which peaked and came down. In November, for the total month of November, we saw 1,175 cases with the transmission rate of, with the community transmission rate of 531. The community transmission rate is very important. Anything above 100 cases per 100,000 for the population is considered community uncontrolled spread, which means that we are tracking it and aggressively communicating with the community to slow the spread through the COVID basics, but it is difficult to track at these numbers. The current cases in December, from December 1st to December 13th, is 1,213. And you can compare that to the November cases, which was only at 1,275. So we've already broken that 1,200 mark for the month of December. And the cases and the current cases per 100,000 for the first 13 days of December is at 505. The total cases for Henry County since we began tracking in March is 9,126. The total deaths, as Don mentioned, we're currently at 136. The positivity rate for Henry County for the last 2 weeks is at 16.9%. The week of December 7th, the Henry County Heritage Site, which Don spoke about, tested 796 community members. And that is on average of the number of community members that is tested at that site weekly, or between 600 and 800. District 4 is working with Dr. Davis and the hospital to slow this spread. We're working with Dr. Davis to manage the outbreaks in the school system. And as she alluded to, there was a significant increase in cases among school-aged children. And we're fortunate that that number did come down. The other thing that I would like to talk about is the vaccine, which is great news. So what we currently have right now is the CDC has recommended that the Pfizer vaccine be disseminated to the community at large. The CDC and the advisory committee has built phases in a tiered approach to who gets the vaccine first. And in the state of Georgia, the phase 1A personnel who will get this vaccine is all healthcare personnel, which are defined as paid or unpaid persons serving in a healthcare setting, and has the potential for direct or indirect exposure to patients of COVID-19. And then we're also going to be working with our long-term care facility partners in Henry County to vaccinate the residents and staff. We're also working with Don and the community with the emergency services to make sure that our first responders who are protecting our community is vaccinated along with this phase 1A so they can continue to do their important job. Right now, we are working with the state public health as well as the CDC to logistically move the vaccine from the manufacturing Pfizer into the Henry County community. And we're working with the Henry County community to set up a appointed dispensing site for those phase 1A, for that phase 1A targeted population. I'm sure you guys have heard a lot about the vaccine. I'm not going to go too much into it. There have been some side effects that has been notified, but for all, from all the safety data that we have seen, that the Pfizer vaccine is a safe vaccine to take, and it will help us slow and stop the spread of COVID-19 in our community as a whole. Some other good news is that the the pharmaceutical company Moderna will be, their safety data was submitted to the FDA, and the FDA advisory committee will be meeting this Thursday to review that safety data and to vote on whether or not to issue a emergency use authorization for that vaccine as well. We are expecting for that vaccine to be approved. And we are expecting to vaccinate phase 1A populations over the next 2 weeks. That is my report. Thank you guys again for allowing me the opportunity to present. Before I go down, I would like to say that Dr. Davis was very correct in stating that the COVID basics, old school public health is what we like to call it, you know, washing your hands, wearing a face mask while in public, and social distancing is the key to us slowing this spread in the Henry County community. Thank you.
Thank you, Xavier. Actually, that was what I was going to close out, and I was going to hand it over to Chair Wood for any board members that may have questions for our panelists. Before I do that, thank you, Dr. Davis, Dr. Henson, and Xavier for being with us as well.
Okay, well, thank you, Mr. Ash. And again, we thank, again, Dr. Davis, Dr. Henson, and of course, Mr. Crockett for joining this evening. So at this time now, we'll open it up for any questions or comments from the Board of Commissioners. So if you will either signal by raising your hand, then we can acknowledge you for any comments or questions. Okay, Commissioner Thomas.
I just wonder what type of information are this committee is circulating throughout the community, other than just informing us, how are you informing the community about the changes and what's taking place? I guess Mr. Ash can answer that. I'm just interested in knowing how are you keeping the community educated and informed as we go forward. That's all I want to know.
Absolutely. So one of the things that we were charged with from our county leadership and our management team is to have one concise message. And I see her approaching the podium. But I will tell you, one of the things she has tasked us with is to make sure that we have a complete message and a single message going from all our partners to our stakeholders throughout our community. And we do tie into all our stakeholders as we deliver those messages.
Yes, Commissioner Thomas. Mr. Ash has somewhat answered it, but we also make sure that through our communications that we are providing this information through all of our social media outlets. Anytime, and I can certainly speak for Dr. Henson and Dr. Davis, when things are changing throughout Piedmont's platform or the Board of Education, they are sharing that information with our county staff as well. And then we're making sure that information is put out to you all if that information is something that we can disseminate. But again, social media is pretty much our platform for making sure that we are communicating the information that we have readily available. We do depend a lot on the Department of Public Health and their website and the information that they're providing. So a number of times you will see a link to their website just to ensure that we have the same message, but it has been our practice that we want to make sure that we are consistent. And we also share this information with our city partners as well. As I sent to you all last week an update on the county going back to a cohort/hybrid schedule, I also sent that same information to our city managers, who in return reached out and wanted to know what we were doing differently in terms of the cohorts and the hybrid. So we are sharing the information, and we have to depend on you all to make sure that you share the information that we're sharing with you all to make sure that it is getting out.
Okay, I think Commissioner Thomas has another question. Yes.
Thank you, Sharon. I have seen some information on social media and do try to share it as much as possible because this is dear to me and this community. I do know that the school system has a built-in database, basically, of parents and students and emergency contacts and what have you. And I'm wondering if that database is being used consistently to all parents and give them an update on information as well.
Let's see, I don't see, Dr. Davis, are you still there? Okay, thank you.
Yes, Madam Chair. The school system has used a couple of strategies. We do have an infant campus messenger system for all families who have an updated email address on file. And we have really pretty consistently done a Friday update to our families and then post that on our district website so you can see a running record of all of the Friday communications. We've also pretty regularly released press releases in anytime there's been sort of a substantial change in operations, so that the Henry Herald is picking up that as a form of communication as well. And we finally have used our robocall and social media as really sort of an ongoing strategy for our families. But that is really further customized by our local school principals, who are also following a cadence of communication to the families in their particular school community. And I've seen a lot of growth of our school council and PTO meetings via this digital environment as well. And so that's really been our strategy. And that's all been collected on the district website under communications related to COVID-19. So I welcome anybody to visit.
Anything else, Commissioner Thomas? Okay, I see Commissioner Clemens. Commissioner Clemens. Let's see. I
Question.
did hear you. Very good,
My-
thank you.
My question is for Dr. Henson at Piedmont. She mentioned the infusion drug that's being administered at the hospital. I know that we have a lot of citizens that are afraid if they get COVID-19 and they go to the hospital, what can be done. I wasn't clear if that infusion was something they give at the onset of the disease. It's something that citizens can come in and take prior to getting COVID-19. I wanted to hear a little bit more about the infusion that she spoke of.
That's a wonderful question. This drug is designed specifically for patients who are not sick enough to need to go into the hospital. So hopefully that will allow us to reduce the number of patients who end up in the hospital. So specifically what we've done is we've set up an outpatient infusion unit where only the COVID patients will come through and get the drug. As you can imagine, typically an infusion unit is giving medications to cancer patients and other immunocompromised patients in for infusion. So the last thing we want to do is expose our patients to immunocompromised patients, to patients who have COVID. And so we've actually set up a separate infusion unit specifically for outpatients for this drug.
You were going in and out a little bit, but I'm assuming you said that if a patient is positive, they can come to the hospital to get the infusion. Is that correct?
Correct. It requires a order, so it isn't as simple as showing up to the hospital to get the infusion. Typically, you will have a positive test that's obtained by a healthcare provider. That person would then put in an order for the drug. And if the person meets the qualifications, because this is a drug that's been just authorized just by the specifically under very specific circumstances, if the patient meets those qualifications, then they would get the infusion.
Thank you.
Okay, any other questions from the board? Okay, well, again, first of all, we thank all of our partners for the collaboration that has occurred as we come through this crisis. So thank you again, Dr. Henson, and we will continue to keep all of our healthcare officials in our prayers. Thank you again, Dr. Davis, for coming to give us the update regarding the work that's going on to of course, keep our children safe and other family members too, but at the same time to provide options for learning opportunities. So we appreciate you and the Board of Elections for that. And then Xavier from the Department of Health, we want to thank you again for the continued work, especially with Mr. Ash in the coordination of getting all of the PPE and to help us coordination and the testing sites. And Mr. Ash, you must be commended, you and also the county management team for all that you all have been doing to make sure that you are responding to the needs of this community. And at last, I'd like to thank the Board of Commissioners for continuing to keep the focus on the testing sites and making sure that it's available to our citizens. And again, we will continue the updates, or the updates will continue, especially as you get into the vaccine time of implementation for that. But again, we just appreciate everyone that's going through. We do, again, thank the county manager for keeping posted on what is best for our employees here during this COVID-19, and again, to make sure that we keep the measures in place. But as it's been stated, again, a lot of it is in our hands of wearing the mask and keeping our hands clean, and again, the social distancing. And again, we're about to approach the Christmas season as well. And just want everyone to continue to make this and take it serious, but at the same time, please take advantage and follow the CDC guidelines as well. So again, we appreciate you all for this COVID-19 update. Thank you for coming in, especially as we enter into more of the Christmas season, and appreciate all of the work that you're doing. So thank you all again. Anything else, County Manager, that you'd like to say regarding COVID-19 before we move to the next agenda item?
I just want to reiterate that we have gone live with our drive-through COVID testing sites. I know Mr. Ash has probably already mentioned it one time, but I want to reiterate that on tomorrow, we will be at North Mount Carmel Park beginning at 10 a.m. for those individuals that need to have a COVID test conducted. We would strongly recommend that you register, but if you don't register, we will still receive you through our processing line. It just takes a little more time for us to get you registered. And then on Friday, we will be in Locust Grove at the Warren Holder Park. And then we'll conclude the week of our pop-up testing. And then when we start next week, we'll be back at Hidden Valley, North Mount Carmel on Wednesday, Warren Holder Park on Friday. Beginning next week, we will also provide at no charge to individuals that may need transportation to get to the testing sites. Our Henry County Transit will be available. We will make sure that we get that information out. So if you know residents that want to get tested, but may not be able to get to the testing locations, we will have buses that are designated specifically for those individuals that need to get tested for COVID. I do want to, again, thank Mr. Ash, our entire public safety team, from our PD, fire, our dispatchers, and everyone else that has really worked hard, and also our Parks and Recreation and Facility Maintenance team, because a lot of work and effort went into getting our drive-through sites up and running. We are expecting a lot of rain tomorrow, but Mr. Ash has already told me that we are going to have that site open, rain or shine. So unless, some tornadoes come through or some really bad weather, just know that our staff will be out there to make sure that we are getting testing done for our residents. I think we have a lot of information to take in tonight, but I'm very pleased with the decisions that we've made in terms of our county employees, and specifically making sure that we're being proactive versus reactive as it pertains to this COVID. So again, thank you, board, for your thoughts in making sure that we have funding allocated for such. And if you have any questions for myself and or Mr. Ash, we'll be more than happy to answer.
All right, well, thank you much. Okay. All right, if there's no further updates, we'll now move into the next agenda item, and it is an update from HealthStat on the Henry Cares Wellness Center and services. So again, I think this is an information-only agenda item, and we'll welcome up Mr. Harold Cooper and Mr. Brendan King, and I understand that Mr. King will introduce some other guests that are there with you. So welcome this evening, Mr. Cooper. I think we see your mask, but we can't see your full face. So I'm not sure what's happening with the camera. I think it has to do with your height. There we go. All right, thank you, sir.
Good evening, Madam Board Chair, distinguished board members. I'm here today to introduce a friend of the county, Mr. Brandon King, to talk about a program that HealthStat has meant for me. As we've just shared, this is a very tumultuous time, COVID-19, but our 1,600 plus employees have stood tall through it all. And we want to ensure that we're meeting their needs holistically. So I will yield at this time and allow Mr. King to step up and talk about the program with some of his team members. Brandon?
I'm not quite as tall as Mr. Cooper, so I'll tilt this back down just a bit. So, Madam Chair, I think you're on mute there.
Well, I'm not sure of everyone else, but I do not. There we are, Mr. King. Okay, now there we go. I just didn't see you at first. So.
Yes, ma'am. I'm not as tall as Mr. Cooper, so I had to tilt the camera down a bit.
Yeah, well, welcome and thank you.
Yes, thank you, Madam Chair, and members of the board for allowing me to be a part of the agenda this evening. So as Mr. Cooper said, joining me tonight virtually, you'll see a few names there on your screen. Hopefully, I have Mr. Brian Bowles, who is my Senior VP of New Product Development with HealthStat. Joining him also is Ms. Jennifer Chrisman, who is our, oh, there she is. She is our triage and care coordination lead for Meant for Me. And then also Brian Urenick, who is my regional director of client services team that I work under and support the local Henry County team here. So as Mr. Cooper said, we have our Meant for Me program that we want to share with you all. This is a mental health service and solution that we are looking to be able to make available to the employees and perhaps the spouses of Henry County employees as well. So with that, I'll turn it over to Mr. Bowles, and then myself and team will be available for questions afterwards as well.
Very good. Thank you, Mr. King. Really appreciate it. And thank you to the board and to allowing us to be here today. Make sure you can hear me all right. And if it's okay, I would like to share a few presentation slides to give folks a quick orientation to the program. And then Ms. Chrisman is going to join in and talk a little bit more about how our program engages with people in the community who may be in need and need access to resources so that they can understand how they can get the support that they're looking for. So give me just a moment to share my screen. Here we go. All right. If I could just verify if you folks can see this okay?
Yes, we can see it. Yes, sir.
All right, thank you very much. Again, my name is Brian Bowles with HealthStat, and again, I appreciate the opportunity to be here. Just a handful of slides to give you a little orientation and talk about how this program is meant to serve the communities. As you know, and we just talked about for the first half of this call, the pandemic and other issues in communities all across the country are creating real mental health pressure on individuals about how they're just coping and dealing with what we've been through here in 2020. I will say the pandemic and a number of social justice issues have really brought this to the forefront into the mainstream, though people dealing with mental health and needing to find support has been something that's been going on for quite a long time. A person's journey to seek help or support for issues they're dealing with is a long journey. You know, it takes almost 10 years for the average person to actually seek help or treatment of some sort. Over half of those with mental health issues that could use support never receive treatment. And only 25% of individuals who seek mental health treatment do, but they don't actually receive the care that they need.
Brian.
Mr. Bowles, if I can interrupt, the only thing that we see a screen share, but we're saying it says welcome to the web tour. So I'm not sure if it's pulling your presentation.
From the right screen, let me move it over here. Let me see if that's better.
And you may want to describe what we should be seeing that may help.
You should see a PowerPoint slide titled The Long Journey to Care.
No, sir. We only see welcome to the web tour at this point.
Okay. I'm sorry. Give me just a moment.
Okay. I'm sorry.
No, thank you for letting me know. We use a different platform, so just a little. Let me just share this. Here we go. This is good. Madam Chair, is that better?
Now we can see the problem, the long journey to care with some data. So very good. Okay, thank you.
Thank you very much for letting me know. I appreciate it. So, you know, just some statistics to set the context, because this has been a big deal for a long time, although now it's really been exacerbated that people have been dealing with all the issues with social distancing, working from home, working with their kids. I have 3 children, and they're virtually, schooling from home all day. There's a lot of stress in the environment, and people need support. And that's part of what we're trying to bring forward with ways that people can get the support they're looking for and meet them where they are based on the needs that they have in the way they want to engage. And that's really important because people really, how do you remove the barriers to receive care? People don't want to talk about this. There's a stigma associated with it. Certainly in the workplace, there's a fear for repercussions if you talk about it with a manager or with peers, and just a general lack of access in many communities around the country make it really difficult and throw up a lot of roadblocks for people to get the support that they're looking for. Our program that we augment the Worksite Healthcare Center with is really intended to provide those modes of engagement that people can get on their own time and in their own way. HealthStat does have a partnership with Johns Hopkins Medicine, which is the #1 leader in psychotherapy and psychiatry. We also work with them on a number of other strategic programs, but They do offer a assessment that individuals can take that takes them through a clinical assessment that gives them a score or a rating to give them a sense of where they fall in a benchmark to different areas. How stressed out are you based on what you're answering? What's your anxiety level? Are you depressed? In different ways that they can go and seek support and care. So 10-minute assessment where people can get a little bit of insight on themselves by going through a tool created and validated at Johns Hopkins Medicine. Also, we know that when people go to seek care and you think about mental health and you think about that sort of support, the first thing that at least comes to my mind historically is I'm going to go sit on a very expensive leather couch and talk to someone that I don't know. And that is the first step. And that is very scary and intimidating for a lot of people who are just trying to get started to figure out what they need to do. And so we do offer something called Tess. This is a chat bot that you can text with, and think of it like a self-help book in your phone. You can express feelings, you can have conversations with it around a number of different conversations threads. There are specific threads about dealing with the pandemic, anxiety, depression, financial issues, and more. And it will do things like help guide you to resources like the EAP program, other things we may customize with. But what this really does as well is gives a safe outlet for people in a mode that they're comfortable communicating with. Everybody texts, not very many people talk on the phone anymore, and that's just how behavior is these days. And so a safe place where they can text and have the chatbot even check in with them once a week. How are you doing? How are you sleeping? And providing coping tools and mechanisms and guidance that they can take advantage of. Now, in some cases, people are in crisis. It might be 2 o'clock in the morning, they're having a breakdown, they need support, it's serious, or they just aren't really sure what they need and how to go about accessing it. And so Ms. Chrisman is going to talk in just a moment about our care coordination service. This allows people to engage with a trained professional that can guide them in such a way that they can get connected with different resources available, either through their employer, like through the city, to be able to get access to the EAP, to our worksite health center, or to other resources in the community that we could customize this, like food banks and other community resources that you want to make sure people have available to them. What's really important here is when people are in crisis, particularly when they're talking about things like self-harm and other very serious things where you need to intervene, if I'm texting with Tess, it alerts the care coordinators at our 24/7 center who will do direct outreach within 60 seconds to that person to check in and make sure that they are okay. And they have a whole process that Ms. Chrisman will talk about in just a moment. People can call in when they're in crisis to talk to someone and get support and be able to be taken care of in the moment. But then lastly, we close the loop by augmenting the Worksite Health Center with a licensed and trained licensed clinical social worker or other like resource who can take appointments and begin and make access to talk therapy much more available through the Worksite Health Center versus just putting them out into the community that they have to navigate on their own. So keeping a holistic approach together so that they can keep connected while not being intimidating and giving multiple ways to engage based on what they're dealing with and how they want to engage. Let me go two more because I know we're a little over on time, but let me, Ms. Chrisman, let me use it to you for a moment and talk a little bit about this care coordination service and how your team works with folks. And then we'll finish with a little bit around texting with Tess to end. But Ms. Chrisman, let me hand it to you for a moment and speak a little bit about how you engage with people when they come and engage with the service.
Sure, absolutely. Our care coordinators, as Brian mentioned, are highly trained in protocols to identify and assess protective factors that individuals may be addressing, and also really be proactive in preventing crisis situations. We operate out of a contact center where we provide 24/7 by 365 access to that care. Critical because, again, we know people have different patterns that they might be following. or work schedules that they might have. So we want to make sure we're always available for an individual when they want to talk or need to have that connection. Brian also mentioned right now it's crucial for connection for individuals, so access to care is very important. What we are and operate under the American Association of Suicidology. We are accredited with their protocols to address any crisis situation. And we are also thrilled that we were just named the 2021 Crisis Center of the Year to address those situations. And some of those factors, we look at suicide as obviously a big area of concern. But there are also protective factors that we address, and we look at the holistic person, because somebody could be in, as we were talking about, financial crisis. So it may be they're in jeopardy of losing their home or losing their job based on situations that are occurring. And our care coordinators are trained to address and look at all of those particular needs, assess the individual by completing a general assessment, and then we identify the needs, and then we connect them. Because as Brian mentioned, a lot of the there's a lot of stigma as associated for reaching out for care. So if we take away and remove some of those barriers, we can take the guesswork out of the connection. Where to go, who to talk to, how do I find out what I have access to in terms of benefits, or what my EAP benefits are, and then how do I get connected to a provider? So we're able to, in that whole experience, be able to be there with them every step of the way. And if there is a crisis situation, we will de-escalate that crisis situation by either we'll do a risk assessment with the individual, we'll do a safety plan if necessary, so that they have something to work through as they're addressing the situation that they're in. We also are equipped to be able to send out wellness or welfare checks if need be, if there's a situation, and also arrange for transportation to emergency services if that is also necessary. A big component of what we offer is not only that initial support, but we also follow up to make sure that connection has been made and has been kept, and that there are no problems along the way to accessing care. Next slide, Brian. So as we talked about, we really quantify the needs and build that bridge. Make sure that the connections aren't broken. Make sure that people understand and can access the resources they need. Brian talked about tests. We're able to have a seamless connection from tests, the chatbot. If somebody is talking about, hey, I need to speak with somebody, they've always got that human connection right at their fingertips, and that's so important. But then in the next step, when we're connecting them to resources, whether they be the mental health provider, as Brian said, a licensed individual that they have access to, or whether it's community resource, or whether it's an EAP resource, we'll continually make sure that we warm hand off that, so that connection is not broken. We'll make sure that if somebody does have an appointment with a mental health provider or has access to the healthcare or the clinic, that we're following up with them to let them to see how their appointment went, if they need help with any rescheduling, or if there's anything else that we can provide to them to make sure that they are addressing whatever obstacles they're facing. And I can't stress enough that that connection piece right now is so critical. Isolation is a big factor that many people are facing, and even the anxiety and depression, just the rates that they're skyrocketing right now during this pandemic. This is a way to provide that support to those individuals who are in need. And as you can see, there's a demo on your screen, or you can see it going through, but TESS is very interactive and can provide information and resources. But the most important thing that's there is there's always a human behind that if there's a higher level of care needed. next slide, Brian. I think we might.
Yeah, sorry, I jumped around a little bit.
That's okay, no worries.
Yeah, and yeah, so just briefly here, thank you, Jennifer, excellent. So as you think about the scope of who may have access to this program, there's multiple ways to engage. Eligible members can text with Tess 24/7 and go through a whole conversation. And I know Mr. King on our team can provide some additional resources that can give you a little bit more insight on how that works in different scenarios. We've got some nice little videos you can take a look at. You can directly call the care coordination team and get connected, as well as connected directly over to, for example, the Hellstat Health Center to get set up on the schedule with the appropriate appointments. And of course, in those crisis situations, Jennifer's team being able to de-escalate those for folks right in the moment so that we've got support all the way around. So many different ways to engage, in different modes to engage that isn't just directly go right into talk therapy with someone, because that's not where the journey begins. And you want to support folks all along where they are as they seek support for the things they need. I think, let me see here. I think that we'll leave that there. Madam Chair, I'll stop there and be mindful of time and see if there are any questions from the board that we would be happy to address.
Again, thank you and welcome, Mr. King, Mr. Bowles, Ms. Chrisman, and also Ms. Uranick. And so at this time now, we will open up the floor for any comments or questions from the board. I think if we may have to remove the screen share so that I can acknowledge and
Yes,
see.
ma'am. Yeah, let me do that
Thank you
there.
very much. I just want to be able to acknowledge them if they have any questions or comments. Commissioner Thomas.
Thank you, Madam Chair. I do want to thank them for their presentations. And first of all, let me thank Sherry for the work that she's done. I have prodded, hoped, pushed, did everything I could behind the scenes from she and I starting this conversation at a Board of Commissioner meeting about 7 months ago, and wanted to make sure we get these services available to our employees, especially for our public safety employees with the stress that they're working under now with COVID, with the stress they're working on with the climate of this whole country. Domestic violence is soaring everywhere. We're questioning racism and who we are. And they are just in a position, they're in a place where they need a place to talk and to make sure that they can perform to their best. And so Sherry said, I'm working on the commission, I'm working on it. And she brought something to us. And I think this is something we need to embrace. I do like the fact that you started with something that's a little personal with my cell phone. So if I don't want to be seen going into an office, don't want to be seen talking to somebody, I have a contact here. And hopefully that contact, if necessary, steer me to another level where I may need to go for services. So it's something I think we definitely need to incorporate for our employees and for all of us, and definitely for the spouses. I understand what it is to have a spouse, to be a spouse and have to come home and receive all that's happened during that day from someone working in public safety, and you have to absorb all of that and have no place for yourself to dump that and get it out of your system. So I think this is very well needed. I'm looking forward to how we can advertise it and communicate it to our employees and to their spouses to say, we're here, this is something we can be used. And my question now is, will you have anything like a group session or group chat for children, for teenagers? Something of that nature so they can be a part of this, because our teenagers are also locked in. We have more runaways now than we normally have. And most of that is because they don't have a way to get out from what situations they're in. How can you help us with our children as well?
Great. Thank you so much. And your comments about those in public safety, your first responders, we work with the city of Wilmington here in North Carolina that has adopted this program exactly for that reason. And they did open it to spouses and other dependents because of exactly what you just explained, not just the person dealing with it, but the environment and those around them and that ecosystem, which is really important. Jennifer, maybe let me let you comment a little bit about sort of the adolescent population from your perspective and Certainly in the health center, depending on the scope of what we want to cover, recruiting the right professionals to be there for those under 18 that have a pediatric specialty is something that we can certainly look for. But Jennifer, also, I know your team is experienced with some of that as well. So
yes, we absolutely are. In particular, adolescents, we can work to customize the offerings to the particular what you're looking for to address those particular needs. We've worked with lots of what we consider, populations that are at risk based on the stress that they're encountering in their positions. And often our children experience that stress as well, or as you said, maybe in foster care or in runaway situations, and access to care is always critical. So we have experience in working. Generally, the age that we have cut off in the past has been 12 years old. But however, that can be customized based on, what we're looking to do. We've offered everything from assessment for needs and connection to resources, both either through benefits if they have available, EAP if there's available to them, or community resources. So we would definitely triage and assess their needs just as we would any, an adult employee who was wanting to utilize the program as well. And they also are very interested in the engagement, and the utilization of the chatbot is also very popular amongst the younger adolescent population, because they can get information at their fingertips, but then they can also, again, we always have that human connection that's backing that chatbot, so we can be there at a moment's notice to bring that higher level of care if need be.
All right, well, thank you again. Are there any other questions or comments from the board? Well, again, we do commend the team that has brought this as an update regarding our employees. And again, I do encourage, especially to our employees, if you would please take advantage of these services that are now available, because there is a lot that many are having to address in our times today. So again, we appreciate the update. Thank you again, Mr. King, Mr. Bowles, Ms. Chrisman, and also you, Mr. Urinek, for joining us today. And Mr. Cooper, we appreciate you as well. So again, thank you, and thank you for joining the meeting this evening.
Thank you. Have a good evening.
Thank you all.
Thank you.
Well, now, board, we will move into the consent agenda, and I will read through the consent agenda items. And again, afterwards, if you'll let me know if there's anything that you wish to remove from the consent agenda for further discussion, I would appreciate that. The first consent agenda item comes from Senior Services, which is a resolution to approve and accept the 2021 Community Needs Assessment. Under Facilities Maintenance, we have two resolutions. One, which is a resolution approving Sourcewell Cooperative Purchasing Contract for the purchase of one excavator from AgPro in the amount of $34,002 using capital funds. The next facility maintenance resolution is a resolution approving Sourcewell Cooperative Purchasing Contract to purchase one Yancey Brother, to actually purchase one Jenny Lift from Yancey Brothers Company in the amount of $41,000. Under the Department of Transportation, we have a resolution awarding a bid for the purchase of one Landau trailer to TM Trailer Sales in the amount of $89,482 using capital funds. And then under the county manager, there's a resolution approving the lease with the Department of Family and Children's Services located at 125 Henry Parkway. So those are the consent agenda items. Or is there anyone that the board wishes to remove from the consent agenda for further discussion? Okay, seeing none, hearing none, the floor is now open for a motion to approve the consent agenda. Okay, see Commissioner Barham, then Commissioner Wilson with the second. Any discussion or comments? All in favor, please signal by raising your hands for the record. Okay, thank you. That is a unanimous approval of the consent agenda. We're now moving to the next item, which is coming from our Financial Services and Grant Administration Department, and is the resolution requesting the Board of Commissioners to approve the Small Business Restart and Nonprofit Assistance Program Committee's recommendations for submission for award. And I do see Ms. Kimberly Monast, who's here to join us. So welcome this evening and thank you for joining us tonight.
Okay. Season's greetings, Chair, Vice Chair, and Commissioners. Tonight I'll be presenting another summary update of the Henry County Small Business Restart and Nonprofit Assistance Program. But before I present the potential awardees that have been recommended by the Review Committee, I do want to highlight some very important information located on our website to assist individuals in need due to COVID-19. Thus far, the Board of Commissioners has approved $1,969,078 in grant funding for nonprofit assistance to Henry County individuals for COVID-19 relief. Two of the awarded programs, A Friend's House and Prevent Child Abuse Henry County, are using their awards specifically to benefit the children in their care, or those who have been referred by the Henry County school system or local social service agencies. The other 11 awardees are listed on the county website for Henry County citizens to know where to go to access critical emergency funding. These nonprofit entities were awarded county funding for individuals in need of housing, utilities, food, and other emergency assistance for COVID-19 relief. We'll put that one on the next one. The next one. Sorry about that. Yeah, the one next to it. Okay. Thank you. Sorry about that. Okay. This is what the page looks like on the county website. If you go to the main county page and you click on the COVID response grants link, which is in about the middle of the page, depending upon what is over it for other information, you come to the applications for small businesses and nonprofits, but at the bottom of this page is a section for individual assistance. These 11 awardees that are currently listed are available for housing, food assistance, utility assistance, et cetera, for individuals in Henry County in need. There will be more this evening if you all are to approve the agenda that I'll put before you shortly. So I would like to let Henry County citizens know that if you or someone you know is in need of assistance due to a negative impact from COVID-19, please go to the Henry County website and find a listing of the nonprofit awardees' websites with information on how to access individual assistance. But it is important to note the following when seeking assistance from our nonprofit partners. Each nonprofit agency has its own eligibility criteria. Henry County government does not determine the eligibility of the individuals seeking direct assistance from nonprofits. Henry County has no authority over the award or decline of applications for direct assistance from any nonprofit awardee agency, so long as the agency's use of county funding follows federal, state, and local laws in its vetting, awarding, operational, and financial administrative processes. If the board approves the nonprofit agendas listed in Exhibit B on tonight's agenda, they will be added to the provided list for easy access for individuals seeking assistance. Oops, all right, sorry about that. So what you have before you this evening is a resolution to accept the Review Committee's newest recommendations to award 13 small businesses and 5 nonprofits for funding. Staff requests that the board approve the Review Committee's recommendations and award these small businesses and nonprofits with COVID-19 relief funding. They are as follows. These 2 pages are the small businesses, and you'll note that the asterisk ones that are next to it that have been before the Review Committee before or have had to reapply. Exhibit B are the nonprofits that would be added to the website along with the 11 that I showed you previously, should they be approved this evening. I'll take any questions.
Okay, thank you for that presentation and update. So are there any questions or comments from the board? Okay, seeing none, I don't see Commissioner Holmes, but anyways, the floor is now open for a motion for approval. Is your signal a motion for approval of questions, Commissioner Thomas? Okay, you're muted, so I'm sorry. It was
One question, please.
Oh, okay, okay, before we open it for a motion. Okay, go ahead, Commissioner Thomas.
And thank you for a job well done. You guys are doing a splendid job. I appreciate the efforts, reading all these documents and putting them in place and trying to get these monies out to people who need them. So thank you so much for that. I wanted to ask, do you have a number or email that if someone went to one of our approved nonprofits for assistance and find that they were not being handled or managed properly, they can at least send some type of information back to you to look into, or we're not doing that? How are we doing anything like that?
Well, I haven't had that information given out yet because I haven't had the need to, but obviously that can be directed to me, the grants administrator, and that would come through my office first. So Kimberly Monist, I can be reached at the county line at 770-288-6540. I'll be happy to take any calls related to any of our nonprofit partners. And I can be reached at kmonast, MONAST, @co.henry.ga.us.
And I
Yes, ma'am.
I think that's important. I wanted to ask too, if you can ask maybe someone in IT to help you all put up some type of rating scale, like 1 to 5, working with Vivian Thomas. How would you rate your application process? Or how would you rate your success in working with this particular partner? Just to give us an idea if we are definitely working with good partners. Just something to think about. You don't have to answer that tonight. I'd just like for you to take that back to your team and you all think about it, please, okay?
Yes, ma'am.
Thank you.
Thank you. Are there any other questions from the board? Commissioner Clemens?
Yes, Kimberly, there is one applicant on the list that was taken off the list or denied before at a board meeting. I think it was a meeting that I had to leave early.
Yes, ma'am. The applicant was not taken
Coming back
off.
to with
Yes, ma'am. I'm sorry, I can't hear.
Commissioner Clemens, I think you faded near the end, and I think she was asking about a applicant that applied before that was taken off the list because she had to leave early. So Commissioner Clemens, are you there?
Can you hear me?
We can hear you, but we can't see you, but we can hear you better there.
I just wanted to get some feedback on that. I noticed that the applicant is back on there. There was some hesitation from the committee, I'm assuming. I just want some more information about that before we vote on it. What's going on with that applicant?
Yes, ma'am.
Okay.
Yes, ma'am. The applicant is Stay Fit Through the Arts, and the applicant had come before you all before, and Commissioner Holmes had expressed some concerns and wanted some more information about the applicant. And I went back to the applicant and he chose to come to public comment. I believe on the December the 1st, he was scheduled for the November 17th meeting, which was canceled. Then he came to the December 1st meeting and spoke in public comment regarding his application. The review committee wanted to go ahead and stand by their initial decision and recommendation to recommend him. And with the additional information that the applicant himself provided, we felt that it was fine to bring him back in front of the board because the information from the review committee had not changed.
Thank you.
Yes,
Okay,
ma'am.
Thank you. Good question, Commissioner Clemens. Any other questions or comments from the board? Okay, hearing none, the floor is now open for a motion. Okay, I saw Commissioner Thomas say motion to approve.
Yes.
Okay, and I saw Commissioner Clemens as a second. Are there any other questions or comments from the board? Okay, all in favor, please signal by raising your hand. Okay, so that's 5, and Commissioner Holmes may have stepped away for the record, County Clerk. So thank you. It has been approved. So thank you.
Yes, ma'am. Thank you. Good night.
Okay. As previously stated, the finance budget item that was on the agenda has been removed as during the acceptance of the agenda. So we'll now move into the community development public hearing, which is a resolution to approve the proposed FY 2019 consolidated annual performance and evaluation report for the community development block grant program, and to also authorize the submittal to the U.S. Department of Housing and Urban Development. So I see Ms. Shannon Sagnon, who's here to make that presentation. So good evening, Ms. Sagnon.
Good evening, Madam Chair and members of the board.
Good
Just
evening.
one second, please. Tech Services is assisting me.
All right, thank you. Okay, we can't see Exhibit 6 now. Moving through it, so thank you.
Thank you.
Okay, there we are. We can see your screen now. Thank you.
Yes, ma'am. Thank you. Excuse me, members of the board, this evening I am presenting before you all the draft for the 2019 Consolidated Annual Performance and Evaluation Report. It is commonly known as the CAPER. This is a requirement of the U.S. Department of Housing and Urban Development upon the completion of any program year. It is a requirement to show the accomplishments and the task achieved and the goals and objectives outlined in any annual action plan, as well as any consolidated plan of expenditures for the CDBG program in a program year. As you all are aware, Henry County CDBG program year is July 1 through June 30th. Our CAPER provides for HUD as well as residents of the county the opportunity to evaluate and take a look at the overall progress of the program and what priorities and objectives were carried out during that program year. It describes the actions, changes, and accomplishments during the program year. Staff did publish a public notice for the draft plan on Wednesday, November 25th. Copies of the plan were made available in public facilities, which are open to the public and also available on the county's website. Some of those other facilities would include the open libraries and recreation centers. No copies were provided in senior centers this year, which is different. We do typically have them there, but that is due to closures. Sorry, I keep hitting the wrong button. In summary, this particular program year, we did complete the rehab of 36 single-family owner-occupied low to moderate income homes. This would include emergency rehab such as weatherization, as well as more substantial rehabs, which could include handicap accessibility, as well as sewer repair and or replacement. We did assist a total of 7 public service activities. Those would include services for homeless, for the local health clinic to provide health and medical services, as well as youth services. We also initiated into 2 public facilities activities. However, these activities were approved by the board in phases and are not yet completed, but the accomplishments and progress in those activities are outlined in the annual action plan. Not including administration, the program did expend just over $950,000 for activities during the program year. Due to COVID-19, the CDBG program, there were a list of waivers approved by HUD for the program to include the waiving of the public service activity cap. Typically, public service activities are capped at 15% of the annual allocation. Again, due to COVID, that was waived. As a result, prior to the CARES funds for CDBG coming in, we did do administrative approvals up to 25% as approved in our Citizens Participation Plan to allow these public services to continue to provide for the emergency needs of our residents being negatively impacted by COVID-19. Another one of those waivers that does impact this program, or specifically this CAPER, is the deadline and extension to the annual CAPER's due date. Typically, you all will probably recall seeing this type of item come before you all early to mid-September because it is typically due the end of September. One of HUD's waivers was to extend the due date for the CAPER until December 31st. So our request for you all today is approval of that CAPER for submission by the end of the year. I'd also like to remind you all that in June of this year, the board did approve a revision to our citizens participation plan, which allowed for the virtual meetings on CDBG activities. So this is a public hearing, and due to your approval back in June, we can hold this meeting virtually as it relates to the public hearing.
Okay, well, thank you, Ms. Sanyal. So are there any, if we'll remove the screen share before we begin the public hearing, I just wanted to find out if there are any questions or comments from the board before the public hearing begins. Okay, this is a public hearing, and individuals who wish to speak were requested to sign in ahead of time, but even if there is anyone available to speak, individuals willing to speak will be allocated 3 minutes per person. So I'll check the county clerk to see, are there anyone wishing to speak during this public hearing?
Chair, there was no one that came in person or signed pre-registered by email, so no, ma'am.
Okay, given that for the record, that does conclude the public hearing. So at this time now, we'll see if there are any other questions or comments from the board. Seeing none, hearing none, the floor is now open for a motion. Okay, I see Commissioner Barham, and if I can clarify the motion, because I didn't hear, you did make a motion to approve. Is that correct, Commissioner Barham? And I saw a second from Commissioner Thomas. Are there any other questions or comments from the board? All in favor, please signal by raising your hand, please. Okay, that is a unanimous approval. So thank you. And thank you, Ms. Senior, for all that you've done with our community development team. So thank you again.
Thank you.
Okay, we'll now move into our next item, which is a public safety item from our Henry County Police Department, which is a resolution approving the proposed revisions to the record service policy. So we're going to invite up Mr. Major Richard Harnett for the presentation. Okay, good evening, Major.
Good evening, Madam Chair, Vice Chair, and Commissioners. It's a pleasure to be here. Thank you for your time in this topic. So I have technical difficulties here.
Okay, no, we're trying to get the presentation on. So
yes, ma'am.
All right, thank you. Okay, I think it's showing here on our screen now. So thank you, sir.
Again, thanks again for your time. This is a resolution asking to approve revisions to the record services policy and to also approve what is now a sample compliance agreement document. Basically, we have some red line changes that were made, and you all have a number of different types of documentation. You have a PowerPoint, you have an existing policy, you have a red line version policy, and you have a clean version of that policy and material. So that is a lot to go through, and I'll try to help move through that. The title of the policy, just to get through the high points of it, would be the change from the record services policy to the record service rotation policy. So let me go back and clarify. This is to clarify that the policy does not cover services provided for the county government's benefit. On page 1, just to highlight the main part, section 1 is purpose and section 2 is the policy portion. It clarifies the intent of the Board of Commissioners to utilize record services who desire to participate in private businesses generated by the county, such as the following scenario where a vehicle accident, the county police officer calls a record to tow and store a private vehicle for the owner. This may be at the owner's request or when the owner is not available to make the request. So we just kind of want to clarify that a little bit. It also clarifies that the policy does not apply to services initiated by the county, such as when a citizen calls a record of their own choice, or services provided to the county when they tow in a county vehicle, or when the county, in this case, most likely the police department calls and has a vehicle towed for an investigative purpose. It also clarifies that before placing a record service on the rotation list and in consideration for placement on the list, that the county may require a record service to sign the compliance agreement in order to participate in that rotation. Pages 2 to 4, under Section 3 procedures, clarify that the window to apply for the record rotation list is October 1st to November 1st. Of course, this also allows the county manager to extend this window at her discretion. It clarifies that as a condition of joining the list each year, record services must submit an agreement to comply with the policy to be eligible to contract with the county to provide towing services for the aforementioned county vehicles and vehicles towed for investigative needs. It prevents record services from joining the policy if they have a history of non-compliance with the policy or other laws. It prohibits record services from responding to county calls with employees who have certain criminal history related issues, namely serious convictions or repeated minor infractions. It requires a record service to continuously provide acceptable response times. And in this case, we're proposing they must be on scene within 45 minutes, absent some unusual circumstance that would take them outside of that. Pages 5 to 10, again, under Section 3, requires that the responding record service fully clear the scene from any debris and so forth and take that away with them to clean up any spills of a substantial nature. It clarifies that the policy does not apply to the services provided for the county, but that the policy will apply to private vehicles that are released to a tow service for impounding after the county law enforcement investigation is complete. So while I mentioned earlier when we call for an investigative impound, if you will, the policy doesn't apply to the front part of that, but when we release it for investigative purposes back to the county tow yard, then that portion of that towing process would apply under this proposed policy revision. It provides an avenue for the record services to petition the county for modifications to the fee schedule that applies under the policy. The goal is to set fees that are reasonable for both the public and the record services. It clarifies the disciplinary procedures under the policy by setting up an escalating system of enforcement, whereby we're proposing to do warnings, suspension process, and then removal with provision for immediate removal for major type violations. It changes the review of the reinstatement processes should we remove a service from the list from the county manager's designee, which at the current time is in my office, to the county manager, and to provide the Board of Commissioners with the opportunity to hold a hearing and ultimately rule on each reinstatement request. It also removes the pre-authorization for records to dispatch vehicles prior to being called by the county. Pages 11 through 14, and we're almost done. Thank you for your patience. There's just a very expanded proposed revision. The fee schedule, it updates the schedule to provide that regardless of what individual charges are assessed, the towing of each vehicle will be subject to a total maximum charge. That is something that is not current in the current policy, rather. This is to prevent price gouging by the record services that allegedly charge excessive fees or provide unnecessary services. For tows of vehicles over 4,000 pounds, instead of a flat fee, which we've currently been operating on, we changed to a calculation of 1 cent per pound or based on the price per pound to ensure that a fair fee is charged on both sides of that equation, both to the citizen and to the record service itself. We have increased, in fairness to the record services, we have increased the maximum allowable fees for certain miscellaneous services such as winching and use of dollies. We've established rates based on vehicle weight for extraordinary services, such as they have to cut through a guardrail or the vehicle's hanging off a bridge. We understand that those are extraordinary, and we've made provisions in the policy for that. And we also reduced the maximum allowable fees for storage. Before I go to the sample compliance agreement, I just want to say the goal of all this has been to create a process that is both fair to the citizen, and that is reflective on the county because we do provide a mechanism for those services. So we wanted to be fair to the citizens, let them have confidence in their in the impound process used by the county. We also want to be fair to the record services. We realize they do have a business to run. However, our main goal is to provide a balance there. The existing policy did not really allow us to do that. It was pretty much worked to the detriment of the customer because once the main fee that was adjusted or complied with in the current policy, there was really nothing stipulating what they may charge for other services and what have you. So we just wanted to clarify that, clarify the charges. And in the sample agreement, which I'll head to next, we wanted something that would require the record services, since they want to participate in this block of business, if you will, that they do not have to compete for. Last year, I would say we did between 7,000 and 8,000 impounds for various reasons, even at a minimum threshold of $300 per, and that would vary because vehicle sizes and incidents is different. You're probably looking at a minimum on the high side, or for 8,000 vehicles, 2.4 million. That is a tremendous amount of business that they're able to engage in, obviously split them on the rotation. So we felt like that in return for that, it would be smart to have a compliance agreement, which basically says that it is a requirement. If you want to participate in the rotation, there is a requirement that they comply with that. It does recognize members of the public as third-party beneficiaries with an entitlement to sue the companies to enforce the agreement. That's something we've never had on behalf of the customer. Acknowledges that the county may remove records from the record rotation in accordance with the policy. And this agreement also acknowledges that the policy and agreement do not maintain, or do not create rather, a property interest in favor of the record services or employer or principal agent relationships with the county. I will say that this was undertaken about a year ago with the help of the county attorney's office and Patrick and his associate Sam. And of course, we could not have done it without Ms. Matthews and Mr. Johnson's input throughout this process. And I'll answer any questions that you might have, please.
All right, well, thank you, Major. We appreciate that thorough update and review of the revisions that are being proposed. I just want to see if there are any other questions or comments from the board. So Commissioner Wilson, and then we'll go to Commissioner Clemens. Commissioner Wilson.
Major, I'd like to see something added to the policy as well to attach a fee schedule to the billing process. So that way it's transparent all the way across the board. When the insurance company or the owner of the vehicle gets a bill, that fee schedule is attached to it. So could we add that to the policy? And another thing I'd like to see to the policy, that all record services have a system in place where they can accept payment on site. If they can accept payment on site, it gives the vehicle owner option to either take it to their private property. So if we could add those to the policies, it would be greatly appreciated.
Yes, sir. Based on our previous conversation, those have been added. You don't have them given the timing. This occurred late this evening, but thank you for mentioning it. I did want to bring it up and make sure that you were aware that those two have been added to the proposed revisions.
Okay, thank you, sir.
Yes, sir.
Okay, Commissioner Clemens.
Thank you, Major and Patrick, for working on this. There was just a couple of things. The policy just.
Commissioner Clemens, can you start over again? I think it kind of bubbled out again on us, so we didn't hear your question.
Major, on page 2, where it says consideration for placement on that list, the county may require a record service to agree or comply. I think they must comply with the agreement. So I know Patrick looked over this, but I don't want to give any discrepancy that they don't have to. So that should be that the county, if they're on the list, that they will require the record service to agree to comply.
Yes, ma'am. We'll make that change.
And then with all the provisions of this policy, it says with the provisions of this policy, we need to state with all the provisions of the policy.
Yes, ma'am. We'll add that as well.
And also under the procedures, I don't see where I know we had the procedures and then we had another section that talked about disciplinary suspension removal procedures. But under the procedures, if a record service has been previously suspended or banned from services with the county, then they should not be allowed to apply if they have partnerships, ownerships, or employees that were on the banned list prior. And I saw that you inserted that under disciplinary suspension and removal, but that should be from the procedure of applying. So they could apply but then they would later be suspended or banned after they've been allowed to participate in the 2.4 million. It should be under the procedures initially.
Yes, ma'am, I can make that change as well, and if Mr. Josh wants to weigh in on that.
So, as a general rule, that's a great idea. There's a little bit of a problem with the expansiveness of it about the prohibiting any employees or any shareholders or anything like that for a number of reasons. First of all, enforcement. We're not in the position, I don't believe, Major Harned and his folks are in the position to review shareholder lists, investor lists, employee roles, because I think in that industry, employees may come and go a lot. It's my recommendation that we apply that ban simply to the company, and we ensure that we're monitoring the performance of those companies. So if we suspend a company and a new company comes and they hire up employees from the previous company, some few, or even if there's investors, rather than us trying to determine whether or not those individuals exist or getting into their books and their financial records, my recommendation is we simply make sure the new company, if they apply and are approved, perform adequately, rather than, I'm afraid what we're doing is setting ourselves up for expectations that we can't possibly meet. We can't possibly investigate their books, investigate every day worth of their payroll and their employee lists. But I do think you make a good point about the ability to reapply. And I think we can certainly make that revision.
So Patrick, I'm only going by the wording that you have, that you already put in there under the employee ownership interest and suspend and remove entities. So if we're putting it in the initial policy to apply, it's just making them aware. We don't have to look at it. But then later, if there's a complaint made, then they're ineligible because they knew that they weren't supposed to do that. So I only use the terms that you have under the disciplinary suspension. So we can say, okay, go ahead and apply. But if we find out about it, then we're going to suspend you because you have it under discipline, suspension, removal, and procedure. So not to enforce it, not for our staff to go have to look for it, but they need to know when they apply that they're not supposed to use people that have been banned. And people that have been banned shouldn't be applying.
Yes, I understand that. I mean, I think yeah, I don't necessarily disagree with that. I'm just concerned about Major Harned and his ability to enforce it. And I just want to make sure that the board is aware of that. So.
Okay,
So we can certainly make the revision as you've stated, Commissioner. I just want to make sure that everyone knows going in the reality of that. And I'm speaking a little bit for Major Harned. We're going to be relying on the applicant's representations.
But Patrick, if they can't enforce it or they're not required to enforce it, but if we find out about it and a person has applied, then they have fraudulently applied for funds from the county that they weren't eligible for. And like I said, I just used what you had under disciplinary suspension and removal procedures.
Right.
So they will be removed. So based on this policy, they're going to be removed if they do that. And I'm saying, don't let somebody apply. Tell them up front that they're ineligible. That's all I'm saying. So I hear you saying it's okay, and we understand that they're not going to go through and look when they apply to know that. That's what happened before. They're not going to know that. But if we get a complaint, which is one of the other lines that we have, that people can make a complaint. If we get a complaint, we got to investigate it. At that time, when Major investigates it and find out that it's true, then they have fraudulently applied for it to be on this list.
Yeah, I think we can make the changes you've stated, Commissioner. I think we can do that. Yeah.
Yes, ma'am.
Okay,
Include those.
Major Harmon, you want to comment on that? I'm sorry. Major
I'm sorry
Harmon,
to interrupt. Yes, to follow up with Patrick, we can certainly include that. And in doing so, the conversations with Patrick always, I'm sure we'll try to beef up that process of keeping tabs on those type of individuals or businesses that do fall under what you suggested, Commissioner. So we'll certainly get that done.
And I want to explain to the board, basically what I'm saying is that we have a strict policy in place now. If someone is banned from our record policy of getting $2.4 million from the county, and then they go back and say, I'm banned, I'm gonna go put it in Commissioner Clemens' name and reapply. They shouldn't be allowed to do that. And the way our policy is written now, we say if we find out, then we're going to suspend you. You can do it, but if we find out, we're going to suspend you. I'm saying tell them up front that that's not allowed. Like we should have it in our policy that you can't do that. You can't come back and apply if you've been suspended or banned from our program. You are not allowed to reapply to be on the list. That's what I'm asking for. So I just wanted the staff to, the rest of the board to understand that's what this was about.
Okay, thank you. And Patrick and Mr. Dockstader and Major, did you get that clearly, I guess? And again, I think I hear you saying that it will be added, and because we do need to summarize what changes are going to be made before the board votes on this to make sure we've got it clear for the record. So please keep track of these recommended changes. Okay. Commissioner,
I have a few more.
Oh, I'm sorry, Commissioner Clemens, I'm sorry. Okay.
Under D on page 4, it says that if one of the record services that's on rotation is found non-compliant, that the county manager will make the final determination subject to the guidance of the policy. And in other sections,
I'm sorry, Commissioner Clemens, what page are you on again?
Page 4.
Under item B?
D is in dog.
Okay, my page is maybe numbered differently. Okay, but go ahead, I'm sorry.
Are you with me, Major?
I believe I am. I'm looking at a red line, but I think you're looking at the clean copy that incorporates all the changes without the red lines. Is that correct?
Yes, I'm seeing blue line.
Yeah, that's what I'm looking.
Okay, yes, ma'am. Okay. Section D starts in the event the county manager's designee determines.
Right.
Is that what you're referring to? Yes, ma'am.
Right. There's another section that says if the record service is non-compliant and complaints are made, that there will be a hearing before the Board of Commissioners. And then in this section, it says if they found non-compliant, that the county manager can make a determination subject to the guidance of the policy, whether the service will be excluded from rotation. I think that if there's a complaint made of non-compliance of this policy, I think that the Board of Commissioners should also be notified.
Yes, ma'am.
I mean, I'm just looking for the consistency because I saw it somewhere else. And then they will be brought for a hearing. And I say, let me tell you why I say that, because when those Board of Commissioners, a lot of times they come to the Board of Commissioners. And so I just want to make sure that we're consistent throughout the policy.
Yes, ma'am. I understand. And with the terms of the board being notified as far as a reinstatement, there is a process for that under the new proposed revisions. But we can certainly stipulate in the verbiage that the board would be notified should the county manager, if I'm understanding correctly, take action to suspend a firm.
Correct.
Patrick, if I said that right, and I can defer. Sure.
Commissioners, I want to jump in because I think the record services has definitely been a thorn in everybody's back because of the number of complaints that have come in. And while we have internally as a staff, I've passed it to our police department. I think it was previously under our E911 department. It's a very difficult policy, or not difficult policy, but it's a difficult field to deal with. And so I would rather the board be the final authority on, if it's a suspension, a termination, you all need to hear it because you're getting the complaints. And while we can investigate and provide you all the information and the recommendations, I think this board needs to make a determination on whether they're going to remove someone from the record policy or if they're going to stay. We will give you all the information you need to make those decisions, but ultimately this is the policy that you all will be creating.
And that's what it says, Sherry. Right here, it says the county manager makes that determination. And I think it should come before the board because it's $2.4 million that we're talking about, and our citizens are complaining. And usually when you're getting these complaints, it's complaints from citizens about something that has happened to them. So,
And Commissioner Clemens, I would also like to add, even the applications, we will receive them, but the Board of Commissioners will approve all of the applications as it pertains to the record policies. So then you all will know who's providing the services. And if you have concerns, if you've received complaints that maybe those individuals haven't filed a complaint with Henry County PD, and at that time you can express, hey, I've received several complaints for this record service. And for those reasons, I don't think that their application should be approved.
And I'll say, Sherry, thank you for speaking up, because I know this has been not only difficult for the board to receive stuff, but you have been personally attacked based on some of the stuff that has been put in your lap because of this. No, this board needs to stand behind their policies. If we're voting on the policies, then we need to stand behind the policies and not put that on you. So thank you for stepping up and seeing where I was going with that. And then down at removed from the list for non-compliance will be, if they're removed from the list for non-compliance, then we've already said that they will be banned from that. That's at the bottom of that. Patrick, also, it says that if there's a violation of any part of this policy, record services, inspections of pertinent documents, that's on 5.6 under that D on page 3. There's nothing that says that if there's a violation of any of this policy, that it will be investigated. So if any part of this policy is violated and a citizen call in and they say there's a violation, in all parts of this policy that's a violation should be immediately investigated. I didn't see where that was written in here. And I say that because, and let me tell you why I say that. We had a gentleman, a person that came to our meetings almost every week. He called Johnny, he called me, he called Gary, he called all of us. And he kept making a complaint, but there was nothing that said that his complaint had to be investigated. So I want to make sure that when people make a complaint, that we must, in a timely manner, investigate that complaint.
Yes, ma'am, we currently do. When we're made aware of them, I do ask when I talk to people, because we get, tons of miscellaneous calls. Hey, I don't like the amount of this bill, or whatever the case may be. But I ask them, in order for me to do exactly what you've asked, to look into it in a more formal fashion, I ask them to provide me with certain documentation or information or what have you, emails describing what may have occurred from their viewpoint, points of interest that they are complaining about. So then I can take that and develop a complaint. And we've enhanced that process over the time we've been rewriting policy. I think we do have a good investigative process on hand. Like any other process, we're always looking to improve it, but we do, when we get to the level of just beyond a basic phone call, we do make every effort to go in and check out and try to see what has happened. And should the new policy be approved, it actually gives us more ability to deal with any kind of violations and so forth. Because right now, the current policy doesn't really give us a whole lot of teeth, relies on a lot of opinion and discretion, which is probably not the best way for all of our combined interests to be making what some might view as punitive or corrective decisions, as opposed to the factual basis in the new policy.
Well, let me tell you why I missed the investigative process, because we used to have it, if they got 6 complaints, that they were removed from the list. Remember that one?
Yes, ma'am.
That has been redlined out. That has been taken off of this new policy.
Mm-hmm.
And so since that's been taken off of the policy, I would like to see a clear investigative policy or investigator line in the policy. I just didn't see it.
Well, I think, if I remember correctly, we took the 6 out to actually make it, because that's a pretty good threshold, because that means 6 people have to follow through a formal process with record service A, for instance. That generally has not happened within the past year, where people actually follow through. They may call about this, that, and the other, but they don't follow through. We're removing that 6 requirement. We've actually lowered or leveled the playing field in favor of the customer, or the citizen, if you will, by making that a much smaller threshold and hopefully leave it so the record companies are less likely to violate because now they know the threshold is so low for them to face corrective action, where before they were pretty much assured 6 complaints, and we'll see how that goes and we'll roll the dice. So the change to remove that was actually a benefit, I think, to the county and to the citizen. And Patrick may be able to expand on that.
Yeah, I agree with that. So just sort of backtrack a little bit. The way it is set up now is that the county manager would make, or whoever the county manager designates, would make the initial determination about disciplinary action, removal, or suspension, and that the record service company could request reinstatement, and it's that reinstatement request that would go in front of the board. And I want to make sure I understand, Commissioner, and I think Chair Sherry as well, that the desire is instead to have the Board of Commissioners make the initial suspension or removal decision as opposed to have that initial decision at the staff level.
Right. Yeah, I'm just talking about if you go to disciplinary, let's go to that one, page 8, board. And under BC substantiated, it says substantiated complaints from customers regarding fraudulent or unethical business practices or excessive billing of customers will call for suspension, removal, or procedures. But there is still no policy of how we're going to investigate it. And I'm just saying that I would like to see that, you know, when this comes in, like when there's a complaint from a customer, what will staff do? Staff will do something, get back with the customer in 10 days. Because what I'm hearing constituents say is that I called, but nobody called me back. I called, if we got a policy, then we'll say, well, what day, Major, did the call come in? It's been 10 days. Have you gotten back with the customer in 10 days? Or Major can say, well, Commissioner, you know, they called and I asked them for A, B, C, D, E, F, G. They didn't do it. So we're still at this phase. I'm just saying there's no investigative phase or policy that we can follow, because now I know, you know, in the last 2 months, we got a call saying I called, I made a complaint, but nothing was done. And then when I talked to Major, they said, well, I asked them for paperwork. They haven't done it. We just need to spell that out in our policy.
We can do
Yeah,
that.
so that's a simple fix. Under that paragraph 1, which has A through H, which are the types of conduct that can result in discipline, we can easily add a phrase to that to require that the county manager's designee conduct an investigation upon receipt of any credible complaint. And I want to make sure we have credible, because we don't need to chase rabbits. So that's an easy fix. The question I have is, does the board want every decision, every disciplinary action to be made initially by the board, or do you only want requests, essentially appeals of those, to go to you? And I think that's your first comment, Commissioner, and the county manager's comment suggested that all of those should go to the board as opposed to the county manager. I want to get a little clarification on that.
I think she was saying suspensions, when it's time to suspend or remove somebody. Like that simple stuff is the county manager and staff can handle. But when you're getting ready to remove somebody or suspend somebody, she'll bring us credible evidence. Hey, I have done this. We got this kind of complaints. This is happening. This is happening. And they violated the policy and it's time to remove them. Before she had to, in this policy, she could just remove them. And I said, I don't think that should be all on her as much as it should be that she built up the evidence. She knows what part of the policy has been violated and is stringent enough that this person needs to be removed, banned, or suspended. And that should come to the board. Sherry, go ahead.
Yes, that was my intent. I definitely not the minor complaints, but suspensions come directly to the board.
Okay. All right. Very good. Anything else, Commissioner Clemens?
Yep, that was it. Thank you.
Okay. Commissioner Thomas, I knew you had some questions or comments.
Thank you, and I think this is a very good policy. One of the things I wanted to ask, if we can add, Commissioner Clemens is trying to make sure that companies that are suspended cannot easily go out and buy another company or get incorporated through another name and easily get back into our system. So I wanted to add, if we can make sure that whatever company is allowed to participate in Henry County, register their vehicles. Register the ID of the truck. It's hard to go buy a new truck and start a new business. So if I am Vivian Thomas Record Service and I have 10 trucks, I need to register all my truck IDs. So you'll know exactly this is my company. So if you throw me out and I come back as Angela Thomas Trucking Company and I've got those same ID numbers, you're going to know really that's me. So that would be one way to track that as well. Because it's not as easy to go out and buy a whole new set of trucks. So I wanted you to consider registering each vehicle by vehicle ID. Make sure we know what's out there. And the second thing is, I don't see a minimum insurance requirement. One of the things we need to have is a minimum insurance requirement that everyone who participates in this program has consistently on all their vehicles, because these trucks are known to cause a lot of damage. And that
Yes, ma'am.
minimum insurance requirement should also include damage to the customer vehicle, not just to cover them, but if you cause damage to a customer vehicle, you have something to protect that customer as well. The customers are complaining they dropped their vehicles and now their suspensions are tore up. They dropped their vehicles and now their tie rod ends are tore up. So we need to have something there to the customer to say, you are responsible for this vehicle. You need to carry insurance to make sure that's done. So I would like to see a minimum insurance requirement to be there. And Commissioner Clemens, this is kind of your field, decide what that minimum needs to be, because I don't know what it really needs to be. And the next thing I wanted to ask a question, because I don't know, is there a registration fee that we are charging per vehicle to be a part of the program? Do we charge anything like that or not?
No, ma'am.
Okay.
Commissioner, as to your first 2 points, the policy already requires that the record service company provides us evidence of the ownership of their vehicles. So we're going to have to get their title certificates or evidence that they're leasing, that they have the vehicles under lease. We also do have minimum insurance requirements spelled out. And we can certainly double check those requirements with risk management and make sure that, that they bless them. But I think those insurance limits are probably sufficient. They're pretty substantial. They're $100,000 and $300,000 for injuries, and they're $50,000 for property damage for each incident. So that's pretty substantial insurance. But we can certainly double check that with our risk management folks, who are your, resident insurance experts. So both of those are already covered.
This document, Patrick, is that insurance requirement notated in this document that we're looking at?
It is. It's section 8 under general requirements.
Okay, thank you.
It's at section 3, it's procedures, and 8 under, or B, I'm sorry. Section 3B has the insurance requirements.
Thank you so much.
Okay, are there any other questions or comments or suggested revisions or proposed revisions? Okay, Commissioner Clemens.
I would like to recommend that all the changes are made. I don't think that they can make them all tonight and present them back to us. But I definitely wanted to see us make the changes so that we can read through to make sure everything is there before we agree on this policy. And then also the last question that I had was, is there an application process, or do they just get on the list? And if there's an application process, I would like to see that application attached to the policy, so that we can review it as well.
There isn't, there is an application process. They're required to, by October 1st, I send out a notice to apply to known record services who want to participate for the following year. There is a particular form that they have to use that we just revised this year. There's tons of documents. We have to have documents about insurance. We have to have documents about the principals of the business itself, who owns it, and so forth and so on. We have all the insurance documents, referencing what Commissioner Thomas was saying about the vehicle registration numbers and so forth. We have all the tag receipts and titles and so forth. All those documents on the vehicles. If they lease a vehicle because they just have to have access to a certain type of vehicle, then we have lease agreements in place and so forth. We have inspection certificates on file from the Motor Carrier Division of the state. So we do ask them to provide a great deal of information to us. Just because they provide it doesn't mean that they do get picked automatically. It's not an automatic process, but when they do submit all those documentations, we do review the file for completeness with, in this case, the current policy. And then we do also go out and I ask them for additional documents, or I go out and actually do an on-site inspection, which I've done this year, to all of the record service that we're interested in applying for the business for next year. So we do most of the things that you all have suggested as regards to documentation and inspections.
Okay, I think Commissioner Clemens, I'm sorry, you still have the floor.
Yeah, and a quick question for Patrick. What happens when we are in litigation with the company that is receiving money or services from us? Why are we still required to have to do business with them? Or can we terminate the agreement at that time when it's a litigation?
As a general rule, the only time we're going to end up in litigation is after we've removed somebody and they sue us because we've removed them. And that's the situation we've had in the past. That we've removed somebody, litigation ensued, litigation ended, and you know, so you all know it's always ended in our favor. And after the litigation is ended, the applicant became qualified again to reapply, and they reapplied anew. And that was the way our old policy was written. The old, I'm saying two policies ago was written that way. You know, one of the problems we have is you can't adopt a law or a policy that's directed at one person. We have to make sure that we adopt this law and this policy that in such a manner that it's not directed to get to one person. And I just want to be cautious that we're not doing that. So, and another thing I will just point out that the last change in the policy that we made was for one of the express directions that we were given by the board was to remove the board from having to act on these things and place them in the hands of staff. So that's the reason the policy was written the way it was, which had the initial termination and removal decisions at the staff level. What we want to avoid is creating another layer of hearing and another layer of due process rights and an entire layer of adjudication on behalf of the board, where it will then take months to effectuate a removal or a termination. So if prior to a removal or a termination, there's a requirement that the board have a hearing and vote, a decision today to remove or terminate or suspend a record service wouldn't be able to be acted on for at least probably a month. So, you know, you're going to delay the effectiveness. So if the board has to vote to remove or suspend an operator, those removals or suspensions will take a long time to go into effect, which is fine as long as the board understands that's one of the results of the policy requiring the board to act.
So Patrick, could you just do it where the county manager makes the decision and the board votes for a stay?
That's essentially how it is now. So the way it is now is the county manager makes the decision. If the record services
appeals,
and it's not really appeal, it's a request to be reinstated, which is essentially appeal. If they want to be reinstated, they then come to you. So the suspension would be effective as soon as the suspension is made. And the board would only be called upon to act if they request to be reinstated. And that allows, I think it accomplishes what everybody wants. It provides some cover for your management team so that they're not getting accused of whatever it is they get accused of. but it also allows those suspensions or terminations to happen in a timely manner. And that's the way it's drafted now.
I think that's good.
Regardless, these other changes are substantial enough that they'll change the document, that we're going to need to spend a little bit of time incorporating those in so it makes sense. You know, we're going to be making some changes as to, you know, notices. We want to make sure notices go to the board. We're going to make some, you know, changes about requiring investigations, and we can certainly have the application form that exists today part of the packet next time. Because I do think you'll be surprised at how in-depth that application process really is. And I think it's a good idea for you to see it.
Okay, well, with that, you know, given the fact that there are a significant number of changes and the county manager has highlighted some, so I wanted to at least open the floor for the motion for the pleasure of the board regarding this proposal.
I would like to make a motion that we table this item and wait on the corrections, and if Major Henson could get it to us and bring it back at our first meeting in January.
Okay, there is a motion. Is there a second? I see a second by Commissioner Holmes. Any further discussion or comments? Okay, all in favor of that, please signal by raising your hand. Okay, that looks to be unanimous. So thank you. And thank you, Major Herning, for all that you've done, and also County Attorney Jock Stetter. So very good. Okay, we will now move into our planning and zoning items. And again, it was previously stated in the amendment to the agenda that the public hearing AP 20-02 regarding the conditional use for property located at 55 Country Road Circle in District 5 has been withdrawn. So we'll move now into public hearing AP 20-03, the Marty Murphy appealing the denial of a variance for development standards for property located at 42 Highway 81 West. And again, this was a request for a reduction of the front yard setback requirements, and this is in District 2. So we see Mr. Kirk, our cluster leader for planning and economic development, here for the presenter for this public hearing. Welcome this evening.
Yes, ma'am. Thank you. Okay. All right. Good evening, Madam Chair, Madam Vice Chair, and Commissioners. Skip through it. Okay, give me 1 second, please.
Okay. And we see that you're catching up the PowerPoint.
No, not the one. There it is. Okay. All right, here we go. Yes, ma'am. This is basically the essence of this variance request, is to subdivide the property as you see here. This is the aerial showing the property. It's actually across the highway here on Highway 20, corner of 20 and 75. There's a tidal wave car wash. It also has a oral space on there as well. This is a layout that they've presented. You have track 1 and track 2. The applicant is wants to appeal the denial of the variance request for this location. The request is to relief from the 50-foot setback to a 30-foot setback in order to divide the property into different parcels. The subject property currently appears to be legal and conforming. The proposed lot split would make the subject property non-conforming, which requires a variance. The Zoning Advisory Board did deny the variance request on October 8th. What I will say is that the applicant was not able to participate in that meeting because there was a miscommunication in the meeting date. Therefore, we have the appeal. However, if the board does see fit to overturn the appeal, there will be 2 conditions that we would like to add to their approval.
So, Mr. Kirk, are you going to cover the conditions as well?
Yes, ma'am, I can do that. So real quickly, the conditions would be to approve the variance with the minimum requirement to allow the 0.301 acres be approved for recording as a separate parcel as currently developed. And additionally, any new substructure and or development on either track 1 or track 2 shall meet all development standards in place at the time of permitting.
Okay.
And the applicant's here. Is there any questions?
Okay. So what we'll do, we'll invite the applicant to speak during the public hearing aspect when we offer it up for those in favor. So are there any questions or comments from the board before we begin the public hearing aspect?
I have a question.
Okay, I think our Commissioner Clemens.
Tucson, do you have a picture of the car wash?
The actual car wash, no, ma'am. Go back to it. What I can show you is how they propose to split the lot.
Yeah, I really wanted the pictures so that the board was familiar with this property and where it's located. When we're sitting 75 South, coming to exit 218, coming to the the admin's building, it's the car wash that's on the right that you can see from the interstate.
Yes,
and that's this property. It's a car wash, and on one part of the property is the building, and the other part of the property is I think the Jiffy Lube, and the wash part of it. So that's what we're talking about, those two parcels.
Right, they currently share one parcel and they're trying to split it to two.
Right, okay. Just wanted the board to know what this.
Okay, all right, any other questions or comments before we begin the public hearing? Okay, so at this time, we will begin the public hearing. Those wishing to speak in favor, including the applicant, will be giving a total of 10 minutes to speak. And those who are wishing to speak in opposition will likewise be given a total of 10 minutes. So at this time, I'll turn it back over to staff to coordinate the public hearing aspect of it. Anyone wishing to speak in favor, including the applicant, may come now. And
Yes, ma'am.
please keep me noted of the timeline, please. Okay.
Good afternoon, Madam Chair and Board of Commissioners. I'd like to thank you at this time, and Mr. Kirk as well, and staff for allowing us this opportunity. My name is Marty Murphy. I'm with Tidal Wave Auto Spa, 124 East Thompson Street, Thompson, Georgia. Our intent of this request is to subdivide the property to maintain harmony in this development. We're not asking for a change in the usage, not asking for anything that would create, dissension in that development as we created in 2017. As you know, in 2017, we opened up both businesses here and have enjoyed the opportunity to joint partnership with this Henry County. I know the application is asking for a 20-foot reduction. We've done some further checking into, and we would like to reduce that 20-foot to a 15-foot reduction. We've determined that the 15-foot would be sufficient and would be compliance with the code. As the property currently sits, the setback, we meet the setback at the 30-foot. If we subdivide, we were concerned, and that's why we brought it for you in this process, because it would change what we think would be required of the front yard setback. We provided Henry County with 2 viable businesses that offer both employment, tax revenue, and possibility of purchasing utility services from Henry County. Tidal Wave is not asking for any biased treatment toward this variance. We've came in to do this process the same that any other business or person would like to come in and go through this process as well. We're not asking for any special treatment. This variance would keep the development in harmony, not to negatively affect adjacent properties. The property will stay contiguous with the code outlined in this overlay corridor. The variance does not give us the ability to change usage, nor is it our intent to change this use. We just simply, because they're 2 different businesses, it's hard to continue as we are, and we would like to separate and have 2 separate properties and parcels And that's why we come before this board to ask for this reduction in this setback. And at this time, I'll be glad to take any comments or questions or anything. And I have Ryan Braun here with me as well. He's the engineer of record that was that helped us develop this project from the original beginning when we started in 2017.
Okay, well, this is a public hearing, so anyone wishing to speak in favor, including applicants, or this is the time allotted to you.
Sherwood, there are no citizens here with us that are want to speak in favor.
Okay. Okay, well, thank you. So at this time now, we'll reset the clock. And anyone wishing to speak in opposition are now invited to come forward now.
Actually, there's no one here to speak in opposition.
Okay. All right, well, thank you. So that does conclude our public hearing aspect. And at this time now, we'll reopen the floor for questions and comments from the board. So are there any questions or comments?
Yes.
Yes, Commissioner Clemens.
To make a comment that staff did recommend denial of this variance, and I know that it has been traditional that we have followed the recommendation of staff. I did have a conversation with staff about this, and I would like for staff or the applicant to be as transparent with this board and the citizens that are watching this as well as you have been with me. There is no change in usage to these parcels. There is no new building that's coming on the property. There's no expansion. It's just two separate. I think that they're looking to sell one of the businesses and they need enough of the property to be able to get the lines right. And so that's why they're asking for variance. Right now, it's a car wash and a Jiffy Lube, and they're trying to separate the car wash from the Jiffy Lube. So they need this variance in order to make two separate parcels. And the way that the conditions are reading that staff has recommended is that if at any time anything changes on this, then this variance would go away. So Toussaint, you are the applicant. If you could just speak a little bit on that. I just want to make sure that we're being very transparent about why staff has recommended that we relook at this and why you guys could not do it, but why we as a board should with the conditions that you have asked us to look at.
Yes, yes, ma'am. So basically, we were creating a non-conforming lot that we reduced to 20 feet. So anything over, I think it's 5%, we have to come to the board for approval. So therefore, that's why we're here asking, that's why we're here to present this to you all tonight. Even with the reduction of the 15 feet, still the board would need to make the approval for the variance to this outside of our administrative abilities. But of course, when we look at the case, again, we cannot create a non-conforming lot in any way. So the only way for it to make this work would be to present it to the board, ask for a variance, and if you grant the variance, then all is well. The conditions basically are just stating that, hey, if anything happens, if they want to tear down the structures and build a new building, you have to go back to the existing development standards that are in place at that time. So based on what they've said, everything's going to stay the same. Nothing will change. So again, it's up to the pleasure of the board how we want to rule on this case.
Chairwood, Toussaint mentioned some conditions, but he didn't place them on the screen. I would like for him to place them on the screen for the board to see.
Okay, thank you. I think that's a fair question. So, Mr. Park, if you could put those conditions there, would be great.
Okay, so unfortunately, I don't have it as a PowerPoint, so I'm not sure if you're going to be able to read this or not. We can try this. It's just gonna, no, it's not going to work. So I can read the conditions again. The approved variance shall have the minimum required to allow 0.301 plus or minus acres, generally corresponding to track 2, is illustrated on the site plan titled McDonald Tidal Wave, with the date indicated in the footer as of 9/1/2020, to be approved for recording as a separate parcel as currently developed. Any new structure and or development on either track 1 or track 2 shall meet all development standards in place at the time of permitting. And I've reviewed these two standard conditions with the applicant, and they are in agreement.
And can we change it to that if there's any new standards or structures that they have to come back before the board?
So the way it reads, if there's anything that changes,
Right.
and it meets the current standards, then they're okay. So if they tear it down, they lose their variance, and it goes back to the original development standards that are in place right now.
Okay.
Yeah.
Okay, anything else, Commissioner Clemens? Okay, Commissioner Barham, and then I'd like to make a comment as well.
Yes, Toussaint, my only question, I don't have any problem with variance, but my only question is, all this is in place right now, and is both of these parcels on the same water meter and the same sewer hookup? I mean, how does that work out?
They're already separate. They're two separate meters. Everything's, yeah, yes, sir.
Two separate sewer lines.
Yes, sir.
Okay. Any other questions or comments? Mr. Jockstetter, I just going to ask you to come forward. I do want to, in the spirit of transparency, just share with the board that I do know the owner of the tidal wave, and also I know he made a contribution to my campaign. And so, Mr. Jockstetter, I just again wanted to clarify, the most ethical thing for me to do, should I abstain or not? And I know that I did receive no personal and will not receive any personal benefit to this, but I just wanted to get your statement, and also to be transparent with the board as well.
Well, the standard for recusal in a zoning case is whether you have a direct financial interest in the outcome of the zoning. Simply knowing the applicant would not disqualify you from voting. In fact, I think it would be almost impossible for people in your position to disqualify yourself every time you know an applicant. Likewise, the receipt of a campaign contribution is not a basis to disqualify you. It can create issues at times. I mean, you cannot accept a campaign contribution in exchange for a vote. But the mere fact that you accepted a campaign contribution would not necessarily disqualify you for voting. The decision you have to make for yourself is whether you are capable of making a fair, unbiased vote on this matter. And if you don't think you are, then recusal would be appropriate. But you're not required under Georgia law or under our ordinances under that state of facts.
All right, I just wanted to be transparent with the board, and also to take a note that there was no conversation between me and the owner, even though we are associates. So I just wanted to get that clear for the record. So thank you very much for that. Okay, any other comments or questions from the board? Okay, hearing none, the floor is now open to motion regarding public hearing.
I would like to make the motion that the decision of the advisory board be overturned, and we allow the use of the variance to be put in place for this property.
With conditions.
With conditions.
Okay, we've had the motion. Is there a second? Okay, I think I saw Commissioner Thomas's hand go up first. So, okay, very good. So we had a motion and a second. Any further discussion or comments? Okay, Commissioner Wilson. Oh, I think you're still muted, Commissioner Wilson. We cannot hear you. Still cannot hear you. I'm sorry. Okay, it's still showing Commissioner. Okay, now we should be able to hear you.
All right, can you hear?
Yes.
Okay. I'd like to get Commissioner Clements to restate her motion because I couldn't hear. She's breaking up.
Okay.
I would like to make a motion that the advisory board's decision, the zoning advisory board decision, be overturned, and that we would approve the variance with the conditions as stated by Toussaint.
Okay. All right. Thank you.
Okay, we've had a motion by Commissioner Clemens and a second by Commissioner Thomas. Any other further questions or comments? Okay, all in favor, please signal by raising your hand. Okay, that looks to be unanimous. So thank you, Mr. Toussaint.
Sam, thank you.
Okay, thank you. We'll now move to the next item again, which was a public hearing that has been withdrawn from the agenda. And that is COMPAM 20-04. And this is the Mandalay Properties requesting an amendment to the comprehensive plan for the property located at 438 Mosley Road in District 4. And likewise, the next item, which was related to that same property, which was a request for rezoning from residential agriculture to single-family residence for the property located at 438 Mosley Road in District 4. Though both have been removed from the agenda and approved by the board for those revisions due to the withdrawal. So we're now moving to the public comment section, and now to our county clerk to see if there are any public comments that anyone signed up for or requested prior to the meeting. County Clerk Braun. Okay, did she step away for a moment? I know she was trying to check to see if there were any public comments that were signed in before.
I'm in the office next to the clerk, and she indicated that there was one individual, Mr. Kolpeck, signed up to speak, I understand.
Okay, I see his name showing now. And so at this time, we will move into our public comment section. Again, this is the time where individuals who signed up prior to the meeting will be allocated 5 minutes to speak. We do ask again that they direct their comments to the board. And again, at this time, we'll ask for Mr. Kolpeck to begin his public comment. And I do need a timekeeper. I don't see the county clerk there, but I do need someone to please keep the time. Okay, so we need to restart it. Thank you. Okay. Okay, you may now begin, sir.
Good evening, Chair and Board.
Good evening.
All right, awesome job on the additional testing sites for COVID-19. Last meeting, I asked about scoreboards at Cochrane. I had one commissioner call me, but I haven't heard any updates since, and I'd like those scoreboards operational for spring ball. And also working personally with some great people to help the homeless in Henry County. Sounds like the CARES Act might be able to help them, and be looking for some help that direction. At the last meeting, the Water Authority wanted to refinance their bond debt, and it would have saved the county $2.8 million over 6 years. And what I heard was, where was the money going? And sounds like some of the people aren't talking to their advisory board members. So if you understand, when you vote against it, that refinancing to a lesser interest rate will save you money, and it's fiduciary duty to save the constituents money. And tonight, just mentioned, was a rezoning plan for D4, and the zoning advisory board denied it. Not sure why, with adjoining neighbors having 1 acre lots, why a developer would come in and try to get half acre or less lots, other than he's padding the pockets. So it would have added 2 classrooms or 6 modular units to the school. And we've stated in the county of Kellytown, we'd really like to stay rural. It's a very nice area, and downzoning is not acceptable in any area. And we're located in unincorporated Henry County. The developer even referenced the recent rezoning of Publix of Kellytown, which our community strongly opposed. And because of COVID-19 and with virtual meetings, I believe it was slid in. The community really didn't have a voice in it, and I'm sad for the homeowners that are forced to have sewers run through their properties now for the benefit of the Publix grocery store. With all the commercial property from 155 to Highway 42 on East Lake Parkway, this should never have been rezoned before the commercial properties were filled up. I suggest that the D4 commissioner meet with the Kellytown residents before considering rezoning request. Being inside the gates of Eagles Landing buffers some stuff from reality, but I'd love to show the D4 commissioner the beauty of our area and why we want to keep it rural. And I've heard from certain commissioners how dangerous meeting in person are. However, no trouble meeting in person on their private time. And I'm not sure about that double standard. And last, registering your vehicles was just brought up real good about registering vehicles, but there's a property on Flippin Road that has unregistered vehicles and dilapidated houses. It's been over 2 years. Really like to see that unsightly property cleaned up sooner than later. And just want to say to everybody, thank you for your service and have a Merry Christmas, safe New Year. Thank you guys and have a good night.
All right, thank you. All right, County Clerk, are there any other public comments to acknowledge? Okay, I think you're muted, so we're unable to hear you. Okay, no more public comments? Okay, all right. We were unable to hear you, but I think I got your head nod to said that there were no other public comments to acknowledge. So that concludes our public comment section. We'll now move into the approval of our minutes for the October 26th called Board of Commissioners meeting, and also for the November 4th regular Board of Commissioners meeting. So if there are no changes or revisions, the floor is now open for approval of those minutes. The floor is now open for the approval of the minutes. I saw Commissioner Wilson, then Commissioner Barham as a second. Any further comments regarding the minutes? Seeing none, all those in favor, please raise your hand by signaling. Yes. Okay, I didn't see, Commissioner Clemens, did you raise your hand? I didn't see yours, I'm sorry. I got everyone else. Commissioner Clemens, I think you're frozen right now. Okay, very good. Okay, thank you. So that is a unanimous approval of the minutes for those days. We're now moving to the county manager's comments, and we'll invite in our county manager, Ms. Sherry Hobson Matthews, for the comments.
Good evening, Chair and board members. This is typically the time of the year where I do present our year-end review, and it is a video, and so I will not be able to show the video tonight, but I'll make sure that it is put on our county website. I don't have any comments outside of, I do want to make one clarification. I mentioned during the COVID update that the testing site at Locust Grove would be open next Friday. I realize that is a holiday, so that testing site will not be open on December 25th, and so I just wanted to provide that clarification. And then finally, before I end my comments, I do want to take this opportunity to thank a very important person that has really been a support, not only for me, but for the entire county. And I'm gonna try to get through it without getting all choked up. But I think the entire board knows that our deputy county manager has accepted a job with Butts County as the county manager, and we are definitely elated that Brad will be stepping into the new role. We're definitely sad to see him go because he has definitely made a huge difference here at the county, not only from a public safety standpoint, but he's really learned a lot of new things when he stepped into the county manager's office. And I know y'all have heard us talk about him being my left, I'm his right, I'm Superwoman, he's Superman. And so we are still gonna be that team, but I do want to take this opportunity because this is his last meeting with Henry County as a deputy county manager. And I don't know if Butts County, has videos, if they have all that stuff in place, but we definitely want to wish him well. So this evening, I do have a certificate of appreciation, and he didn't know that I was doing this because he doesn't like surprises. And you all may be able to see the soft side of Brad Johnson. So I'm going to ask Brad to come forward. Give him time because he's huffing and puffing. So give him a couple of minutes to get up here. I'm going to put my mask on so I can stand a little bit closer to him. So I have a certificate of appreciation for Brad Johnson, our deputy county manager, in recognition of Henry County Deputy County Manager Brad Johnson for his 32 years of outstanding leadership and devotion to Henry County and its citizens. Henry County government extends its heartfelt appreciation for his several decades of exemplary, messed that word up, service, devoting much of his career to public safety through the Henry County Fire Department, and then lending his knowledge, skills, and talents as deputy county manager in the county manager's office. Brad, I just want to personally thank you, and I'm going to give him an opportunity to send his well wishes to the board before I get all choked up. So I'm going to turn it over to Brad, and after Brad concludes his comments, Sherwood, that will end my comments for this evening. And season's greetings to all of you all.
Cool. Thank you, board. Thank you, Sherry, Madam Chair. It's been a pleasure. I appreciate the support from the board and Henry County as a whole. Great place, great employees, great team, and wish you all the best. And I'm not too far away. I'm still right down the street. So if you need anything, let us know. But thanks for everything you guys have provided us. Thank you.
Well, I'll kick it off, and of course, we'll kind of move into the commissioner's comments as we proceed. But Mr. Johnson, we definitely wish you the very best as the county manager for Butts County. And the good thing is Butts County is right next door to Henry County. But you have definitely served this county so well in all of the capacities that you served. And again, as our deputy county manager, your tireless work, your dedication, your leadership, I'm sure Butts County will definitely benefit from. So I'm going to go to the other commissioners just to allow them, and then I'll have some other comments as well. But again, Mr. Johnson, we wish you the very best. Commissioner Holmes.
Brad, I just want to say it's been a pleasure working with you throughout the years. You've been an amazing employee and also an amazing assistant county manager. I'm sure you're going to do a great job in your new role. They are blessed to have you. And I just want to say good luck. And again, like you said, you're right next door, and I'm sure we'll continue our friendship for years to come.
Thank you, Commissioner Holmes. Commissioner Clements.
And I echo everything that everybody said, Brad. We definitely knew that you wouldn't be with us forever because you've just been soaring the whole time that you've been in Henry County. And you were assistant, you were deputy chief standing in before we got the chief in for the fire department. And to shine, and that shine. Make us proud. You'll always be part of Henry County. And I'm glad you're close by so we can at least have lunch.
All right, thank you. Commissioner Wilson, I think I saw you next.
There we go. Yeah, Brad, you and I go back, I don't know, probably 32 years. When I first come to work here, you and I worked the same shift. I think rode ambulances together in fire trucks and fought fires. And I've called you Brad, I've called you Lieutenant. You was my lieutenant at one time, you was my captain, then you was my chief. Yeah, we've served a lot of time here in county together, and well-deserved position in Butts County. And thank you for your service and your dedication for Henry County. You're going to be missed, brother. Thank you.
All right, Commissioner Barnes.
Brad, we're going to miss you, buddy. But I know you're not going to be too far away. And I hope you keep the same cell number so we can still call and talk about you. But it's been a pleasure working with you. And I look forward for you to do great things in Butts County. And if you don't, we're going to get after you. Well, good luck, Brad. Thank you.
All right. Thank you, Commissioner Barnes and Commissioner Thomas.
Brad, I just want to say for the time I've been here, you have absolutely spoiled me, and you know it, because you will take care of me like nothing. I can make one phone call and say, I need bread, you got it. I needed information, you did it. You made me look so good, Brad, as the incoming commissioner, and I want to thank you for that. There were times I just needed answers, and you found those answers. And I'm glad it's right there in Butts County, so I can still tap into you and still take advantage of you a little bit. But congratulations, well-deserved. Well-deserved, Brad, and we're proud of you.
All right, well, let's give him another round of applause. Congratulations, Brad. And of course, and best wishes to you as well. And so we're still into the commissioner comments. Are there any other comments from any of the other commissioners? Commissioner Wilson, and then Commissioner Thomas.
So Chair Wood, this is your last scheduled meeting with the Henry County Board of Commissioners. It's been a pleasure working with you over the last 4 years. We appreciate your leadership and your friendship, and you're going to be missed. I know you come out of retirement to take this position, so I'm hoping that you're going to go back in retirement and continue enjoying your life in retirement. So thank you and good luck.
Thank you, sir. Thank you. All right, Commissioner Thomas was next, and then we'll come to Commissioner Holmes and then Commissioner Barr. Commissioner Thomas. I think you're muted, Commissioner Thomas. I'm sorry.
Do that, okay. I just wanted to say in this season of Christmas and where we are now, that I wish everybody a Merry Christmas and a safe Christmas. I'm looking forward to 2021. I hope you all are too. We're going to say goodbye to 2020 and get ready for a fantastic 2021, Henry County. I think that will happen for us with our leadership that's coming in from the nation, that's going to set the whole tone of where we need to go. And to our chairperson, he said, enjoy your retirement. If I know you, you're not going to go sit down. It's just not in you. I can see you in the community into something. That's just who you are. And thank you for what you've done for the county, for the time that you've been here. I look forward to being wherever you are in the community, doing something with your hands and with your heart. God bless you, and thank you for the time you've given us here.
Thank you. Thank you, Commissioner Thomas. Commissioner Holmes.
June, I'm just going to say it has been a pleasure working with you. I know it gets a little rough up here on the Board of Commissioners, but just to let you know, it's never personal. It's rough issue to issue, but overall, we try to do our very best to represent our constituents and to work together. So. You will be missed. Again, you're a great leader in our community, and enjoy your retirement, and we will always be here if you need us.
Thank you. Thank you. Thank you, Commissioner Holmes.
Merry Christmas, everybody.
Yes, very good. Commissioner Barr.
Well, Chair Wood, follow everybody else's footsteps on this. It's been a pleasure working with you. You've done some great things for Henry County. You've provided great leadership, and you are always a hard worker. And it's been a pleasure for me to have time to work with you. But I know your time is not going to come to an end for Henry County. And I know your heart's in Henry County, and you're going to continue to work for Henry County. And we're going to be calling on you as well. And with information and that sort of thing, but it's been a pleasure, and Becky and I, we really appreciate our friendship and gonna continue that friendship, and I just appreciate what all you have done. Thank you.
Thank you, Commissioner Barr. Well, thank you so much. Commissioner Clemens.
And to the Board of Commissioners, again, this ends 4 years for Chair Wood. It's the end of my 4-year term and the beginning of another 4 years. And so to June, we want to continue to, I hope that we will see you and continue to learn to bond and connect as we continue to do what we're supposed to do for citizens and constituents and people in general. Merry Christmas to everybody. June, retire, enjoy your life. I wish we could take the stress off every day, but you have an opportunity to kind of to rejuvenate yourself before taking on more stress. So take that time and do that. I think there has to be a relief for a lot of things. It may be some bittersweet things for some things, but at the end of the day, it's God's will that has been done. And so we just have to keep moving forward and thank him for what he does for us in life.
Thank you. Thank you, Commissioner Clemens. Commissioner Barr, did you have something else you wanted to say? Oh, okay. Well, let me just say this all started for me as a divine mission to use my God-given talent, skills, and abilities. And I just really appreciate these 4 years. I know that the Lord allows, us to be in position, and he allows us not to be in position, but I do trust that Henry County is in such great hands. For this board, I will continue my prayers for you. I mean, I have prayed for us quite frequently for wisdom, because as it's been stated, these are very difficult positions. And until somebody really gets into a position like this, I don't think that they have an appreciation for the personal sacrifice, the family sacrifice, and to stay focused on what is best going forward. And then, of course, to work with others in other agencies. So, Board of Commissioners, again, you will continue to have my prayers. To the citizens, again, as I served in the community before, as the Lord has led, I will get rest, especially to spend a good quality time, because I am a mother. Let me get this right. I'm a wife, a mother, and a grandmother. And I just thank the Lord for them for being so supportive over these last 4 years. And again, we've already got great plans into the future. So again, my heart and will continue to be to wish the very best for Henry County. I see still a great, bright future for our county. Even with all of the changes that have happened, even in 2021, it's been tough. But look at all of the great accomplishments over the last 4 years that this board has allowed to have happen. And that then leads me to a very important comment to the county manager, the deputy county manager, the staff, our executive assistant, Michelle Weaver, the county clerk, the county attorney, and all of the 1,600 employees. This county has really moved in a great direction with so much change and still being the fastest growing community. But there's so many things that you should be proud of that you as the employees helped to provide to our citizens. And the beautiful thing is that Henry County has a very positive mark now in a lot of ways. And it's because of the work that occurred mostly with our employees, but definitely with the direction and guidance of this board as policymakers, and to make sure that the funding resources were there. So I, again, just thank Henry County. I thank the partners that Henry County has. I will continue to pray for our chair-elect, Carlotta Harrell, who will be joining this team. And again, asking that the Lord provides wisdom to all of everyone. But again, as we enter into Christmas, I do want to encourage everyone to please remain safe. There's a lot of individuals that lost loved ones, and I know there's still emotions that are out there, but Henry County is full of great people. And I just, again, will continue to pray that God will bless this county and to bless the people and the families that are in there. And then again, for this board, I do wish you all the very best going forward. But it has indeed been my honor to serve and my honor to represent. I think the best thing that I can conclude my comments with is what my husband said to me. My husband said, June, I know you entered into this to serve the people, but I think the people have served you. And it is because he says that I have become a better individual, a better wife, and my children have even made comments, and my family have made comments of how much stronger I am in a lot of ways, and continue to hold who I am in caring for people and loving people. And I want to say thank you to God Almighty for helping me to continue to stay focused and to do what was right in the best interest and to not think about myself. So given that, Merry Christmas, everyone. So thank you all. Blessings to you all. So at this time now, we will move into the next agenda item, which is regarding our upcoming meetings and events. The next Board of Commissioners meeting, which is January the 6th at 9:00 a.m., which is the regular Board of Commissioners meeting. Please note that that is a Wednesday and not the regular Tuesday, the first Tuesday. And then the second meeting is January the 20th at 6:30 p.m. And it too is a regular Board of Commissioners meeting, and it too is on a Wednesday. So please note those dates and those days into January. So hearing nothing further for the good of the group, we'll now accept the motion to adjourn. Okay, I saw Commissioner Holmes and then Commissioner Barham as a second. Any further comments or thoughts? Given none, let's all say Merry Christmas and consider ourselves adjourned by voting. So thank you. So congratulations. Thank you all. Have a good night. And thank you all for those who were tuning in this evening.